The dog came through the doors like a grenade with teeth. 110 pounds of retired combat muscle, all scar tissue and suppressed rage, dragging a decorated Special Forces sergeant across the linoleum like the man weighed nothing. Staff flattened against the walls. A technician knocked over an entire tray of instruments, scrambling backward. The handler, a man who had survived 2 combat deployments and come home intact, was shouting at everyone to stay back, that the dog would take a hand off, that nobody should move. Nobody moved, except her. The nurse in the corner, the one with the stained scrubs and the name nobody bothered to learn, stepped forward into the open space, and the dog stopped like he'd hit a wall. If this story pulled you in from the very first second, like this video, follow my channel, and drop your city in the comments right now. I want to see exactly how far this story has traveled. Now let's begin. The morning had started the way most mornings started at Redwood Falls Animal Trauma Center, badly, and without sufficient warning. Nurse Nora Voss had been on shift since 5:30, which meant she had been awake since 4, driving 40 minutes down a 2-lane coastal highway in a truck that hadn't had reliable heat since February. She had pressed a gas station coffee cup against the windshield to clear the frost and arrived with a damp sleeve and a paper bag containing a breakfast sandwich that was already cold. She ate it standing at her locker. Nobody asked about her drive. Nobody asked Nora much of anything, and she had been working at this facility for 2 years. That was not self-pity. That was just the shape of her mornings, and she had made her peace with it. Redwood Falls sat in the lower stretch of Northern California's coastal range, a city that looked prosperous from the highway, with clean off-ramps and a wine-adjacent economy that pulled weekenders up from the bay. But underneath that surface, there was a workforce that had been quietly pressured for years. The Animal Trauma Center where Nora worked occupied a converted industrial building on the east side of town, updated enough to be functional, not updated enough to be comfortable. It served civilian patients, dogs, cats, the occasional exotic, and through a regional contract that Nora herself had helped draft language for during the previous director's tenure, it also served retired military working dogs from the federal installation at Fort Calloway, 30 miles inland. That contract was the facility's single most important revenue source. It justified 3 full-time nursing positions. It justified the new surgical suite that Dr. Strike had been wanting since before Nora arrived. It was, in practical terms, the reason the lights stayed on through the slow months. Nora had negotiated the original terms. Nobody remembered that now, or perhaps nobody had ever known. She had handed the completed draft to the previous director on a Tuesday afternoon, and by Friday he had presented it to the Fort Calloway liaison over lunch, and taken the credit with the particular ease of someone who had long since stopped distinguishing between other people's work and his own. Nora had watched this happen. She had filed it and moved on. Dr. Pamela Strike had arrived 8 months after the contract was signed, recruited from a regional hospital network in Oregon to replace the departing director, and she had inherited the Fort Calloway relationship the way people inherited things they hadn't built, with confidence that it had always been hers. Strike was not incompetent. That would have been easier. She was competent in a very specific register. She ran clean procedures, maintained spotless documentation, kept her referral network warm, and projected the kind of authority that came from never visibly doubting herself in front of staff. What she was not was curious. She had arrived at the outer edge of what she knew and stopped there, and she had enough skill to work effectively within that boundary, and enough authority to ensure nobody pointed at the boundary in her presence. She had 2 associate veterinarians, Dr. Marcus Ewan, 6 months out of his residency, and Dr. Sandra Albrecht, who had been there 4 years and was competent and overworked and perpetually waiting for a raise that hadn't materialized. There were 3 vet techs, a part-time radiography specialist, and 4 nurses including Nora. Of the 4 nurses, Nora was the senior by experience and the last by standing. She was not the nurse Strike consulted. She was not the nurse who got pulled into interesting cases. She was the nurse who handled intakes nobody wanted, who stayed late without being asked, who wrote the documentation so thoroughly that other people could hand it directly to insurers without revision, and who received, for this, a nod of acknowledgement approximately once a quarter that conveyed absolutely nothing. The other nurses were not malicious. They were just young and social and operating in a facility with a clear pecking order, and Nora did not fit into any tier of that order in a way that made her legible to them. She was older, quieter, and had a quality of self-containment that people who didn't know her sometimes read as coldness. Brett, one of the vet techs, 24 years old, loudly opinionated, lavishly inexperienced, had called her basically furniture that can take blood pressure readings in the break room 2 weeks ago. The comment had gotten a laugh. Nora had been standing 2 feet around the corner in the hallway. She had returned to the surgical prep area and finished sterilizing the instrument tray she was working on and gone on with her day. By Thursday, things like that stopped arriving with weight, or she had learned how to let them pass through her without catching. She was at the nurse's station, a folding table jammed between the medication cabinet and the window that fogged over every morning regardless of the weather, reviewing intake charts and updating the post-op monitoring log for a shepherd mix who'd had a splenectomy on Tuesday when she saw the truck. It came through the parking lot fast for a parking lot. Dark blue, government plates, a heavy-duty F250 that had seen road use. It stopped at an angle that suggested the driver had not been thinking about parking when he pulled in. The door opened before the engine fully died. Nora put the clipboard down. The man who came through the front entrance was large without announcing it, broad through the chest and shoulders, economical in how he moved, carrying himself with the particular efficiency of someone trained to function under weight and pressure. He was in civilian clothes, a dark jacket and work pants, but his posture was not civilian. Early 40s. 3 days of beard, a jaw that was doing significant work right now, holding his expression in a controlled place. He was not controlled. She could read that in the set of his shoulders, the way his eyes moved across the room the moment he entered, taking inventory. He was managing something, hard. Then the door opened behind him and she understood what. The second man came in on a short tactical lead, and the dog at the end of it was the dog doing the leading. Belgian Malinois, tawny-coated, deep-chested, and low to the ground in the way that communicated speed before it communicated anything else. He had a notched left ear and a scar across his right shoulder that had healed fully but left a permanent ridge in the coat. His eyes were going around the room in fast-controlled arcs, cataloging everything, and his body posture was the posture of an animal in pain who had decided that aggression was the safest available position. Nora knew that posture. She had seen it before, in a different building, in a different life. Everyone stay where you are. The large man's voice was calibrated, not loud. The voice of someone trained to cut through noise without wasting energy on volume. He will bite. Do not approach him. Do not crouch down. Do not reach out. Stay back. Monica, the front desk receptionist, had risen from her chair with the automatic hospitality of someone whose job required it. Sir, I'll need to ask you to... Sergeant Major Callum Drake, Fort Calloway, K9 unit, retired. He didn't raise his voice. He didn't have to. I called ahead. This is Ranger. He needs to be seen immediately. The dog surged at the sound of Monica's movement. Not a full lunge, just enough, just a sharp explosive shift of weight toward her, and Monica sat down so fast her chair hit the wall behind her. Brett, across the room, pressed himself back against the supply cabinet with both palms flat. Dr. Albrecht, who had come into reception to pull a file, went very still near the doorway to the back hallway. Strike appeared from her office with the practiced timing of someone who had developed an instinct for when her presence was required. She took in the scene with one fast read and adjusted her expression to the particular blend of warm authority she'd spent years perfecting. Sergeant Drake, she said, stepping forward with careful deliberateness. I'm Dr. Strike, director of the center. We spoke earlier this week. We're very glad you brought Ranger in today. Drake looked at her. He won't let your people touch him. He's been like this for 6 weeks. Your Fort Calloway liaison told me you had staff experienced with military working dogs. We absolutely do. I've managed multiple MWD cases from Fort Calloway personally, and we're fully equipped for Ranger's evaluation. If you can bring him back to... Nora was already moving. She hadn't made a decision about it. That was the honest accounting. She had not thought it through, had not weighed the optics of walking past Strike in front of a client, had not calculated how this would be received, or whether this was the moment to do it. She had simply moved the way she moved when something in a situation registered before her reasoning caught up. The way her body sometimes processed a clinical picture faster than her conscious mind could articulate it. She came around the end of the nurse's station table and walked into the open space of the reception area. She stopped about 8 feet from the dog. She did not crouch. She did not extend her hand. She did not make any of the sounds or gestures that people made when they wanted animals to find them friendly. She just stood there, weight balanced, breathing normally, looking at a point slightly past him. Ranger's head turned toward her. His ears, which had been pinned flat in maximum threat posture, shifted. Not down, not relaxed, but different. The hard scanning of the room stopped. He looked at her with the full particular attention of an animal running a very specific calculation, pulling on years of training and experience and whatever else went into the algorithm that working dogs ran in these moments. He took one step toward her, then another. Drake's grip tightened on the lead. "Don't move." "I'm not moving," Nora said, quietly, evenly. Ranger reached her and pressed his nose into her hand, hard, deliberate, the specific kind of contact that meant something different from a domestic dog sniffing. It was recognition, not of her specifically, but of a category she belonged to, a type of person he had encountered before, in other rooms, in other circumstances. The posture in his body changed degree by degree. The rigid readiness did not disappear entirely, but it shifted weight, redistributed, settled into something that was still alert but no longer primed for violence. Strike had stopped speaking. Drake was looking at Nora the way he might have looked at an intelligence report that contradicted everything he'd been briefed. "What's his injury history?" Nora asked. She wasn't asking Drake. She was asking the younger handler, who had come in behind the dog and was now standing near the door in a state of visible bewilderment. He was mid-20s, fit and earnest, and he blinked twice before he answered. "Right rear hip. Started 7 weeks ago. He was walking with a slight hitch. We thought he'd pulled something on a trail run. Base vet saw him, soft tissue diagnosis, started anti-inflammatories. Didn't improve. Saw him again 4 weeks later, same conclusion, adjusted the medication. He stopped responding at all and the aggression escalated. He was the most stable dog in the unit for 6 years, and then he stopped. It's like he's a different animal." Nora was moving her palm slowly along Ranger's back, reading the topography the way you read a page. Not pushing, just receiving information. She felt the shift in how he carried his weight, the subtle drop toward his left, the overcorrection in his left rear that told her the right side had been hurting long enough to change his gait pattern at a foundational level. When her hand reached the upper right hip, he stiffened, not sharply. He had enough discipline not to react sharply, but enough. She stepped back. "I need him in an exam room." "Nora." Strike's voice had changed register. The warmth was still technically present, but it had been reorganized around something else, something that needed management. "Thank you, but Ranger needs to be evaluated by one of our veterinarians. I'll take it from here." "I know he does," Nora said. "I'll assist. Room 3 has the space for him. Dr. Ewan is available." "Dr. Albrecht is the appropriate—" "Room 3, Nora said. She said it without heat, without confrontation, without the energy of someone picking a fight. She said it the way you stated a fact about a room. There was a silence with several distinct layers to it. Drake broke it. "Can she walk him back?" He asked the question to the room generally, but he was looking at Nora. The young handler looked at Ranger, who had moved to stand beside Nora's left leg, with the settled posture of a dog who had made an assessment and acted on it. "Yeah," the handler said. "I think she can." Exam room 3 had better lighting and a larger floor than room 2, and Nora had chosen it for both reasons, but primarily because a dog Ranger's size needed room to shift position without feeling cornered, and cornered was the last thing she needed him to feel right now. She walked him in without the lead. She hadn't decided to do it. She had simply unclipped it while they were in the hallway because his body language told her it was the right moment, and he had continued walking beside her without a pause. Behind her, she heard Drake make a sound that was not quite a word, a contained exhale, something released and recaptured in the same breath. She got Ranger settled on the exam room floor, positioned him on his good side with enough care that he didn't have to bear weight on the right hip, and was already running her hands along the affected area with more deliberate attention when Dr. Marcus Ewan came in. He looked at the dog, at Nora on the floor, at the posture of the animal who had reportedly been attacking everyone who came near him, and he made a quick assessment. "Tell me what you're seeing," he said. He didn't try to take over. He took out his notepad. This was why Nora could work with Ewan. He was new enough to still treat the intake process like an information problem rather than a credentialing exercise. He wanted to know things, even when the knowing came from a nurse. Right hip, significant compensatory shift to the left, she said. He's been loading the left rear to protect the right for long enough that the gait pattern has reorganized around it. You can see it even when he's at rest, the way he angles his pelvis. That's not acute. Anti-inflammatories haven't touched it because this isn't a soft tissue inflammation issue. The handler said the base vet cleared him twice on examination alone. You need imaging. How long has he been presenting this way? The handler gave me 7 weeks, but the degree of compensation I'm feeling suggests the underlying injury is older than that. He may have been managing early symptoms for significantly longer before it became visible in his movement. Ewan was nodding before she finished. Full hip series, lumbar, pelvis. Positioning is ready? He looked up from his notepad. I thought you'd want it, she said. Drake had come to stand in the doorway. He had stopped trying to take the lead back from the table where Nora had set it. He was watching her the way he had been watching her since the reception area, with the expression of someone doing a recalculation they hadn't planned on doing today. Getting Ranger into the imaging positions required 40 minutes, not because the dog was uncooperative, but because Nora refused to rush it. Every position change was preceded by enough time for Ranger to understand what was being asked of him, and each time he was asked something uncomfortable, she gave him 30 seconds on the other side of it before moving to the next thing. She worked with the specific patience of someone who understood that trust in this context was not a given. It was a negotiated agreement, renewed moment by moment, and could be withdrawn at any point if she pushed past the terms. The radiology tech took the films. Ewan put them on the light board. He stood there for a long moment without speaking. Nora, he said. She looked. The fracture was a subcapital femoral fracture, a break at the junction of the femoral head and neck in the right hip. It was not a fresh injury. The bone margins had attempted to heal, a process that spoke to more than a year of the body trying to manage damage that had never been properly addressed. The fracture line was clear and complete. The displacement was partial but significant. Around it was the structural evidence of chronic loading on a compromised joint, changes in the surrounding bone density, micro-damage to the adjacent structures, the whole architecture of how Ranger's right hip worked, reordered around an injury that should have been caught in the first week. Ewan was quiet for a long moment. How did this get missed? He asked. He wasn't asking it rhetorically. He was asking it the way you asked a question when you genuinely could not construct the answer from available information. You wouldn't catch it without imaging, Nora said. A physical exam tells you there's pain and some range of motion limitation. If you're looking for soft tissue injury, soft tissue examination makes logical sense. You need films to see a fracture, and if nobody ordered films, nobody ordered films. For 7 weeks, she said. Drake was no longer in the doorway. He was standing at the light board, looking at the image of his dog's hip. His face was doing the thing faces did when the information arriving was not the information you had been bracing for, when the news was worse in a specific way you hadn't prepared for, and the inadequacy of your preparation was itself part of what was hitting you. He had known Ranger was in pain. He had known something was wrong. He had been pushing the base vet system for almost 2 months trying to get someone to take it seriously. But knowing your dog is hurting and seeing the structural evidence of how long he has been hurting, how many days and weeks he had continued working and moving and existing on a hip that was fractured, were not the same knowledge. Can he be fixed? Drake asked. His voice was level. It cost him something to keep it level. Surgical repair is the standard approach for this fracture type, Ewan said carefully. Given his age and overall conditioning, he's actually a better candidate than a lot of dogs I'd see with this injury. But I want to be honest with you. This fracture is not recent. He's been in significant pain for a long time. Drake nodded once, slow, the nod of someone absorbing something that had to be absorbed. We can get him into surgery within 24 hours once we have pre-surgical clearance, Ewan continued. Recovery will take time, but the prognosis is good. Okay. Drake cleared his throat. Okay. Thank you. Ewan stepped out to begin the pre-surgical protocol. The room was quiet. Drake looked at Nora. You found that in 15 minutes, he said. She was checking Ranger's gum color, pressing gently on the capillary refill. She didn't answer immediately. The Fort Calloway vet had him twice, Drake said. 7 weeks, 2 examinations, cleared him both times. I'm not going to speak to another provider's clinical decisions, Nora said. No. He kept looking at her. But you know exactly what they missed and why. Yes. How? The room held the question for a moment. Ranger exhaled slowly beside her, the deep settling exhale of a dog that had been holding tension for a very long time and was, in this particular room, for this particular moment, allowing some of it to go. I've worked with dogs like Ranger, Nora said, military working dogs, in a different setting, a long time ago. She said it without elaboration, without the verbal texture that would have invited follow-up. And Drake, who was good at reading what was being offered and what wasn't, didn't push it. Not yet. His phone buzzed. He looked at the screen and something in his expression shifted. Not dramatically, but in the way that specific information caused specific changes. A micro-adjustment of the muscles around his eyes and jaw that she caught because she was paying attention. I need to step into the hallway for a minute, he said. Take your time, Nora said. He's not going anywhere. Drake went out. Nora sat down on the floor beside Ranger and put her hand on his rib cage and felt him breathe. His breathing was slower than it had been in reception. Not fully relaxed. She wasn't sure he remembered how to be fully relaxed, but slower. She had been sitting there for about 4 minutes when Drake came back. He closed the door behind him, which was a different action from leaving it open, and she noticed the difference. That was Fort Calloway, he said. Base operations. She waited. There are 2 federal investigators on their way here, he said. They're coming to this facility. He paused. They asked for you by name. Nora Voss, not Dr. Strike, not the facility director. They specifically asked whether Nora Voss was still on the premises. The exam room was not cold. Nothing about the physical space had changed, but the quality of the air shifted the way it did in the moment before real weather arrived. The pressure change that came before the thing itself. Did they say why? Nora asked. Her voice was steady. They said... Drake looked at her directly, measuring something. They said to tell you that case file Kestrel was being reopened. 14 years collapsed into 1 second and expanded back out again. Nora took one breath through her nose, let it out through her mouth, set her jaw the way you set something you needed to hold in place. Okay, she said. You know what that is? Drake said. Not a question. Yes. He looked at Ranger, at Nora, at Ranger again. Does it have something to do with why you were able to find his injury when 2 Fort Calloway vets couldn't? She stood. Ranger stood with her, careful on his bad side, leaning slightly into her leg. How long before they get here? She asked. 40 minutes, maybe 35 now. She nodded, and something in the architecture of her face reorganized. Not hardened exactly, but clarified, the way a landscape clarified after rain. Everything more precisely itself than it had been before. She had been Nora Voss, the quiet nurse with the stained scrubs and the folding table nurse's station for 2 years. She had been that person deliberately, and she had been good at it. But that was a different kind of good than what she was actually good at. And for 14 years she had kept those 2 things carefully separated. Whatever they tell you about me, she said, all of it is true. She picked up the lead from the exam table and clipped it to Ranger's collar with the clean efficiency of someone who had done this 10,000 times in buildings that were not this building, and she walked him toward the door. At the threshold she paused. He needs his pre-surgical blood work, and I want him on mild sedation for pain management before he goes to imaging review, she said. I'll come back for that, but right now I need to make a phone call. To who? Drake asked. Nora looked at him over her shoulder. Someone who's been waiting a long time for me to make it, she said. She pushed through the door and Ranger went with her, and Drake stood alone in the exam room with the light board illuminated behind him. The fracture line still bright and permanent and damning in the film. The name of a case file he had never heard before suspended in the air where she had left it. Down the hallway, past the break room where Brett was on his phone, past the medication cabinet, and the fogged window and the folding table that was her nurse's station. Nora Voss turned into the small staff office at the end of the corridor. The one with the lock, the one with the landline, the one nobody had officially assigned to her, but that she had quietly claimed months ago, for reasons she could not have easily explained at the time. She locked the door behind her. She picked up the phone, and 14 years of silence ended with 7 digits dialed on a Tuesday morning in a coastal California city that had no idea what was about to arrive inside it. The phone rang twice before someone picked up. She didn't say hello. She said, "It's Voss. I'm in Redwood Falls, Northern California. They're coming here. A pause on the other end. Not the pause of someone caught off guard, the pause of someone who had been waiting for a specific call and was now processing that it had finally arrived. How long? The voice was male, older, the particular flatness of someone who had spent decades keeping his register neutral regardless of what the information was. 30 minutes, maybe less. Are you somewhere private? Yes. Okay. Another pause, shorter. You still have the copies? I've always had the copies. Then you're not alone in this. You understand that? Nora looked at the wall. There was a calendar on it from 18 months ago that nobody had taken down, and a pushpin board with scheduling notes that had nothing to do with her, and a water stain near the baseboard that had been there when she arrived and would be there when she left. Ordinary things. The furniture of a life she had been living carefully for 2 years. I understand, she said. Don't talk to them without knowing who sent them first. You know how to check. Yes? Voss. The voice shifted. Not warmly. That wasn't the register this man operated in, but with a specific gravity. You did the right thing walking away when you did. And you're doing the right thing now. She hung up before he could say anything that would have required her to respond to it. She sat in the locked office for approximately 90 seconds, which was as long as she allowed herself. Then she stood up, unlocked the door, and walked back down the hallway toward the exam room. Strike was waiting for her outside it. This was not a coincidence. Strike had positioned herself in the hallway the way people position themselves when they had decided a conversation was going to happen and were managing the location of it. She had her arms crossed, not aggressively, but with the specific body language of someone who had decided they were holding something that needed to be held. Nora, a word. Nora stopped. I need to get back to Ranger. Dr. Ewan is with him. He's fine. She kept her voice low, the courtesy of someone who understood hallways had ears. I need to understand what happened out there. I walked the dog to the exam room and assisted with the intake assessment. You walked into my client consultation and redirected the care plan without being asked. The dog was in distress and I had relevant information. You're a nurse, Strike said, and then seemed to realize how that sounded and recalibrated. What I mean is, the appropriate thing would have been to flag what you were observing to me or to one of the veterinarians and let them... There wasn't time for that chain of communication, Nora said, and Ranger had already accepted me. Disrupting that to transfer care to someone he hadn't accepted would have set the intake back by an hour at minimum and caused him unnecessary additional distress. Strike held her gaze. Where did you work with military working dogs before? That's not something I discuss at work. It is when it affects how you conduct yourself in my facility. Dr. Strike. Nora kept her voice even. No heat. No rise at the end that would have made it sound like a challenge. Federal investigators are going to be here in approximately 20 minutes. They've asked for me specifically. Whatever questions you have about my background, I would suggest you hold them, because the next half hour is going to require the facility to respond professionally to federal oversight, and that conversation is going to be significantly more important than this one. Strike's expression went through several quick stages. Surprise, recalibration, the professional reflex to contain the surprise, and then something underneath all of that, a wariness that was not entirely about Nora. It was the wariness of someone who had just been handed information that repositioned things she thought she understood, and who was smart enough to know it, but not fast enough yet to see exactly how. What do the investigators want? Strike asked. I don't know the full scope yet, Nora said, but it involves Ranger's case, and it involves me. She paused. I'd appreciate it if you let me get back to my patient. Strike stepped aside. Nora went back into exam room 3. Ranger was lying on his good side with his chin on the floor and his eyes tracking the door. When Nora came in, his tail moved once, a single controlled sweep, like a flag acknowledgement. Ewan was crouched beside him, updating his notes, and Drake was against the wall, arms crossed, phone in hand but not looking at it. He looked up when she came in. She didn't address him first. She crouched beside Ranger, checked his gum color again, pressed 2 fingers to the inside of his rear leg to read his pulse, and counted quietly. His resting heart rate had come down from when she'd first handled him in reception. Still elevated for a dog at rest, but the pain and stress combined could account for that. I'm going to start him on a low-dose analgesic while we wait for surgical clearance, she said to Ewan. Meloxicam, conservative dose given his weight and the imaging findings. I don't want to mask the injury. I want to take the edge off enough that the pre-surgical assessment isn't being run on a dog in acute distress. Agreed, Ewan said. I'll write the order. I already pulled the dosage chart. I just need your sign-off. He signed it without looking. Then he did look, and almost smiled, but was professional enough not to. He gathered his notes and stepped out to begin the pre-surgical paperwork, which left Nora and Drake and the dog. Drake waited until the door closed. Who did you call? Someone who needed to know I was here. That's not an answer. No, she agreed. She was preparing the injection draw, her hands moving with the automatic precision of someone whose hands did this kind of thing without requiring full conscious attention. It's not. Drake looked at Ranger, at Nora. He had the quality of patience that people who had spent time in high-pressure environments sometimes developed, not passive patience, but the kind that was itself a form of pressure, the willingness to wait long enough that the other person ran out of reasons not to speak. Nora had the same kind. She had learned it earlier and practiced it longer. You knew what you were looking for before the x-rays came back, he said finally. You knew what you were going to find. I suspected. That's not a response a nurse with general training gives. That's a response someone with specific experience gives. Yes. She capped the syringe and set it carefully on the tray. It is. Military working dog rehabilitation, he said slowly, like he was building a sentence from parts he'd collected separately. You said you worked in that context before nursing. She turned to look at him. She gave him what she hadn't given him in reception, which was the full weight of her attention without the practice management of it. I was part of a classified unit at Fort Meade, she said, military working dog rehabilitation and medical assessment. We handled dogs that came back from deployment with injuries or behavioral sequelae that the standard base vet structure wasn't equipped for. Complex cases, long-term care protocols, dogs that had been through things that required a different kind of assessment framework. Drake was very still. I did that for 6 years, she said, and then I stopped, and I became a nurse, and I came here. Why did you stop? She looked at him for a moment. Because I found something I wasn't supposed to find, and I reported it, and reporting it ended my career in that unit. The exam room was quiet. Outside in the hallway, the normal sounds of the facility continued. A phone, a cart, someone's voice asking a practical question about something practical. The ordinary infrastructure of a working day, indifferent to what was happening in this room. What did you find? Drake asked. That's what the investigators are here about, she said. So if you don't mind, I'd like to wait and let them explain it in a context where everyone who needs to hear it can hear it at the same time. She picked up the syringe and knelt beside Ranger. Hold him steady. Drake moved without hesitation to the position she needed, his hands on Ranger's shoulder and hip, with the experienced confidence of someone who had done this before, who understood that holding a dog for a medical procedure was about presence and pressure in the right places, not restraint. Ranger felt him and held still. The injection went clean. Ranger's ear flicked once, and then he settled. He trusts you, Drake said quietly. He trusts that I know what I'm doing, Nora said. That's not the same thing, but it's enough. The two federal investigators arrived at 11:47, which Nora knew because she was watching the parking lot from the staff window when the unmarked sedan pulled in. They sat in the car for about 90 seconds, long enough to finish a conversation, too short to suggest they were uncertain about anything. Then they got out. The woman was first. Mid-40s, dark suit, hair pulled back with the utilitarian efficiency of someone who had made a permanent peace with practicality over appearance. She walked like someone who owned the ground she was on without needing to announce it. The man with her was younger, late 30s, with the particular alertness of someone who was paid to notice things and had been doing it long enough that it happened automatically. They came to the front desk. Monica looked at their badges and picked up the internal phone. Nora was already in the hallway. Agent Delaney, she said. The woman turned, looked at Nora with a fast, comprehensive read. Ms. Voss? I know why you're here, Nora said, and I know where we should do this. Follow me. She didn't look back to see if they were following. She walked to the conference room at the end of the administrative wing, a room that existed primarily for insurance audits and quarterly staff reviews, and which was, at this moment, unoccupied. She held the door. They came in. She closed it. Sit or stand, it doesn't matter, she said. Before anything else, I need to verify your chain of authority. I need to know who opened the case and at what level. Agent Delaney looked at her with something that was not quite surprise, but was adjacent to it. The look of someone who had expected a different posture from the person they were meeting and was adjusting in real time. You know the verification protocol, the agent said. I know a lot of protocols. Verify. Delaney said a number, then a name, then a date. Nora held all three against the information she had been given 14 years ago in a procedure she had memorized and never written down, and found them accurate. Okay, she said. She sat down. Talk. Delaney sat across from her. The younger agent, she introduced him as Agent Falco, took the chair to the side and opened a notebook. Old school. Nora respected it. 17 months ago, Delaney began, a procurement audit at Fort Calloway flagged irregularities in the contracts for military working dog veterinary services. The audit was triggered by an anonymous tip. When investigators pulled the contract records, they found a pattern of falsified medical clearances spanning approximately 9 years. Nora did not change her expression. Dogs with documented injuries were cleared for retirement service categories that should have required medical disqualification, Delaney continued. Cleared by contracted veterinary providers who were being compensated above standard rate for those clearances. The financial arrangement was structured to obscure the relationship between the payment irregularities and the clearance decisions, but once auditors knew what to look for, the pattern was clear. How many dogs? Nora asked. Delaney paused. Current confirmed count is 43 animals across 6 years of the scheme. We believe the actual number is higher. Nora looked at her hands on the table, flat, still. Some of those dogs were placed in civilian retirement situations, Delaney said. Some remained in service longer than they should have. At least 7 died in the past 3 years in circumstances that may be attributable to untreated injuries. The number sat in the room for a moment. Ranger, Nora said. Ranger's case came to our attention through Sergeant Major Drake's formal complaint to the Inspector General's office 8 weeks ago, Delaney said. His complaint was the third one in 18 months to name the same contracted veterinary provider at Fort Calloway. When we cross-referenced Drake's complaint with the audit findings, we identified Ranger as a likely case study. His injury timeline, the nature of the misdiagnosis, the provider who cleared him, it fit the pattern. And me, Nora said. Why am I here? Delaney looked at her directly. Because 14 years ago you filed a complaint at Fort Meade that described in substantial detail exactly this scheme. You identified falsified clearances, you named a contractor, you presented documented evidence, and your complaint was reviewed by Major Dennis Harwick, classified as unsubstantiated and sealed. The room was very quiet. Major Harwick retired as Colonel Victor Harwick in 2019, Delaney said. His name appears in the financial records from the Fort Calloway scheme. There it was, 14 years and 4 sentences. Nora had known, in the abstract, that something like this was possible. She had known it the way you knew things you couldn't prove and couldn't get anyone to listen to, not as fact but as a shape in the dark, a thing you moved around in your daily life without being able to name it directly. She had filed her complaint. She had been separated from her unit. She had gone to nursing school and moved 3 times, and ended up in Redwood Falls, California, with a folding table nurse's station and a truck that didn't have heat. And the shape in the dark had had a name the whole time, Victor Harwick. Your original evidence, Delaney said. Do you still have it? Yes. All of it? Everything I submitted in 2010, plus documentation I collected in the 6 months before I filed. Hard copies, 3 separate locations. Delaney and Falco exchanged a look. Not a dramatic look, a professional look, the kind that communicated information between people who worked together without requiring the information to be spoken aloud. Ms. Voss, Delaney said, your original complaint is going to be the evidentiary foundation of this case. Without it, we have financial records and a pattern, but the pattern needs context. It needs someone who can testify to how the scheme operated at the operational level, who made the decisions, what the clearance process looked like from inside. You're the only person we've found with direct observational knowledge of how this worked. I was 29 years old, Nora said, and I had 2 years of experience in the rehabilitation unit. I wasn't senior enough to be in the decision-making rooms. I was junior enough to be overlooked when the decisions were being made. Which is why you were able to observe what you observed, Falco said. He had a quiet voice, lower than she'd expected. Junior staff are invisible in a way that senior staff aren't. People have conversations in front of them that they wouldn't have in front of people they consider significant. Nora looked at him. You're right, she said. They do. She had been invisible her entire working life. At Fort Meade, at the Sacramento Hospital, at Redwood Falls. She had watched things happen in hallways and break rooms and the corners of rooms during meetings that the people in those rooms assumed were private because they had looked at her and processed her as furniture. She had been watching for 14 years. She had been watching all along. I'll give you everything I have, she said, but I need something from you first. What's that? Delaney asked. I need Ranger's case formally documented as a consequential injury resulting from a falsified clearance, not as an administrative irregularity, not as a clinical oversight. I need it documented as what it is, a specific, identifiable harm to a specific animal caused by a specific fraudulent act. Because there are 43 confirmed dogs, and probably more. And when this goes to prosecution, I want every single one of them named. Delaney held her gaze for a long moment. Then she said, That's already our intent. I want it in writing. You'll have it. Nora nodded. She looked at the water stain on the conference room wall. There was one here too, different shape but similar origin, the building having its own history of neglect that had nothing to do with hers. She looked at it for about 2 seconds, and then she looked back at the agents. I need to finish taking care of my patient, she said. You can wait here or in the reception area. I'll be back within the hour. She stood up. Delaney looked up at her. The contractor who handled Ranger's clearances. His name is Wendell Graft. He's aware the case has been reopened. We believe he's aware of your involvement. Nora's hand was on the back of her chair. She didn't tighten her grip. Is that a warning? It's information, Delaney said. How you use it is up to you. Nora left the room. She did not go directly back to the exam room. She went to the medication cabinet, pulled what she needed for Ranger's pre-surgical protocol, double-checked the dosages against the weight Ewan had logged, and stood at the cabinet for approximately 45 seconds, doing nothing except breathing steadily and letting what had just happened settle into something she could carry while she worked. 43 dogs, 7 dead, Victor Harwick. She had been 29. She had been in that unit for 2 years, and she had watched the contractor, not Graft, a different man, the man who had recruited Graft a decade before he built his own operation, come through the facility twice in 1 quarter with a clipboard and a smile and a manner that was just a few degrees too comfortable for someone conducting a legitimate administrative review. She had watched documentation vanish from files she had personally compiled. She had watched dogs she knew, dogs she had worked with, dogs she had monitored through pain management protocols and physical rehabilitation, get cleared for service categories that required movement their bodies couldn't sustain. She had been 29 and junior and invisible, and she had done what she believed was the right thing. The right thing had cost her everything she had been building in that unit, her position, her clearance, her career track. It had not cost her the copies she had made, because making copies had been the kind of quiet, preemptive action that was native to the way she thought. She had not made them because she was planning for a conspiracy. She had made them because she was thorough, and she trusted her instincts, and her instincts had been telling her for 3 months that the documentation was at risk. She closed the medication cabinet and went back to work. Drake was in the hallway outside exam room 3. He had a cup of coffee from the staff machine that was probably terrible because the staff machine produced reliably terrible coffee, and he was holding it with both hands without drinking from it. He looked at her when she came down the hallway. How bad is it? He asked. Bad enough that it's going to be in the news, she said, and that's all I can tell you right now. Does it go beyond Fort Calloway? She stopped beside him, looked at him the way she looked at things when she was deciding how honest to be. Yes. His jaw tightened. How many dogs? They gave me a number. I'm not going to repeat it yet because it'll likely change, and I'd rather you hear the accurate number when it's confirmed. She paused. But prepare yourself for it to be significant. He put the coffee cup down on the windowsill beside him and pressed both hands flat against the sill and looked at the parking lot for a long moment. She let him do it. People needed the moment when information arrived. The 10 or 15 seconds where the body processed the weight of something before the brain took over and started building responses. He's been suffering for over a year, Drake said quietly. Not to her specifically, to the parking lot. I brought him in every time I saw something wrong. Every time the symptoms got worse. They cleared him, and I started thinking. He stopped. That you were wrong, she said. That maybe I was projecting. That maybe I was so worried about him that I was seeing problems that weren't there. His voice had something rough in it now. 7 years that dog worked beside me. 7 years in conditions that would break most things, and I was almost talked into believing my own eyes were wrong. That's what the system was designed to do, Nora said. Make the people asking questions doubt themselves, instead of doubting the answers they were being given. He turned and looked at her. Is that what happened to you? I didn't doubt myself, she said. I just couldn't prove it to anyone who mattered at the time. She looked at the exam room door. Let's go take care of your dog. Inside the room, Ranger had shifted to his sternum, his front legs extended, his chin resting on the floor in the particular posture of an animal that was using conserved energy as its primary coping mechanism. The analgesic had taken some edge off. She could see it in the slight loosening of the muscles around his eyes, the way his ears were sitting lower and more neutral. She went through the pre-surgical protocol methodically. Temperature, weight confirmation, secondary cardiac assessment, coagulation factor review. She marked each finding in the chart with the handwriting that was too small and too precise, the handwriting of someone who had written in the margins of small notebooks in the dark and developed a permanent economy of penmanship. She was midway through the cardiac assessment when her own phone buzzed in her pocket. She ignored it. It buzzed again. She checked the ECG trace, logged the reading, set the equipment down, and pulled out her phone. Unknown number. California area code, not local. She looked at Drake. Give me 1 minute. She stepped into the small anteroom between the exam room and the surgical hallway, a transitional space barely big enough for 2 people, and answered. Voss, she said. The voice on the other end was male, middle-aged, with the specific tension of someone managing a great deal of anxiety through a membrane of artificial calm. Ms. Voss, you don't know me by name, but I think you know who I represent. You might want to identify yourself, she said. My name is Wendell Graft. A pause. I think we should talk before the situation goes somewhere neither of us can walk back from. The small anteroom was very small. Nora leaned her shoulder against the wall and looked at the scuff marks on the baseboard. You're the contractor, she said. I'm a veterinary services consultant with a 12-year professional history and a family. I'm also someone who made decisions under pressure from people significantly above my pay grade, and I'm now looking at federal criminal exposure for things that were directed by people who will not be standing in the same courtroom I'm standing in. The artificial calm was eroding at the edges. I think you understand what that means. Why are you calling me? Because you're the one who started this. 14 years ago, and because the investigators showing up at your facility today means you're going to finish it. He took a breath. I want to know what you're giving them. You want to know how much exposure you have, she said. I want to know if there's a version of this where I cooperate and that cooperation is recognized. That's a conversation to have with your attorney, not with me. Ms. Voss, Mr. Graft? She kept her voice level, flat. The particular flatness of someone who was not angry, but was fully, precisely resolved. I'm going to give the federal investigators everything I have, every document, every record, every note I made over 14 years. And if you're looking for a version of this where your cooperation gets recognized, then cooperate with them. Not with me. I'm a nurse at an animal trauma center in a small California city, and I have a patient waiting. You should reconsider what records you hand over. His voice had changed. Lost the veneer of reasonableness, settled into something with more edge to it. There are people involved in this who have resources and motivation to complicate your life in ways that, Mr. Graft, she said, I've been living a complicated life for 14 years because of what your scheme did to my career. You're not threatening me with something that hasn't already happened. Silence on the line. Do yourself a favor, she said. Call an attorney. Cooperate with the federal investigators. And do not call this number again. She ended the call. She stood in the anteroom for 5 seconds. Then she opened the exam room door, went back to Ranger, picked up her stethoscope, and finished the cardiac assessment. Drake was watching her. "Everything okay?" he asked. "Yes," she said. Then, because she had spent 14 years being honest when it mattered, "No, but it's manageable." She listened to Ranger's heart, steady, strong, the heart of an animal whose body had been badly served by the people responsible for it, but had kept going anyway. "I'm going to need to speak to Agent Delaney again in a few minutes." "The investigator." "Yes." She logged the reading. "Someone just called me. Someone connected to the scheme. He wanted to know what I was giving investigators." Drake went very still. "He called you? On your personal phone?" "Yes." "Do the investigators know?" "Not yet." She set down the stethoscope. "But they're going to, because whatever was said on that call and how I responded to it is probably relevant to how they build their case." She looked at Drake. "I'm going to give them the phone." He looked at her for a long moment. "You kept him on the line." "Long enough," she said. And outside in the parking lot, Agent Delaney's phone was already ringing because a call to a person of interest in an active federal investigation from a number associated with the named suspect was exactly the kind of real-time development that the trace protocol she had quietly activated before entering the conference room was designed to catch. Delaney was out of her car before Nora reached the parking lot door. That was the first thing Nora noticed. The agent was already moving, phone pressed to her ear with one hand, the other raised to signal Falco, who was coming around the front of the sedan at a pace that was not quite running, but was the thing directly before running. Whatever the trace had returned, it had returned fast, and it had returned something worth moving for. Nora pushed through the door and Delaney saw her and ended the call in the same motion. "He called you," Delaney said. "Wendell Graft, unknown number, California area code." Nora held out her phone. "Full conversation. He wanted to know what I was giving you. I kept him talking." Delaney took the phone with gloved hands. She had produced the gloves in the time it took Nora to cross the parking lot, which said something about how she operated. She passed it to Falco without looking at him. "How long was the call?" 3 minutes and change? Maybe 3:20. "Did he make any specific threats?" "He implied that people connected to the scheme had resources and motivation to complicate my situation. He told me I should reconsider what records I handed over. I told him to get an attorney and not call again." She paused. His voice changed when I didn't give him what he wanted. The reasonable man register dropped out. Delaney was already texting with her free hand. "Did he indicate how he knew you were here?" "No, but he knew my number, which means he has access to information about me that he shouldn't have through legitimate channels. Either someone fed him my contact information in the last 2 hours, or he's had a file on me for significantly longer than today." Falco looked up from the phone. "This is enough for a warrant." "I know," Delaney said. To Nora, "We're going to need a formal statement about the call, verbatim to the extent you can reconstruct it." "I can give you a verbatim reconstruction. I was listening carefully." Delaney looked at her with the same quick recalibrating assessment she'd been making since the conference room, the look of someone repeatedly updating a model. "You activated the trace before we sat down." "I know the protocols for contact with a federal investigation," Nora said. "If I was going to be named as a key witness, I was always going to be a target for this kind of call. It was a question of when, not if." "You've been thinking about this for a while." "I've had 14 years, Nora said. "I've had a lot of time to think." Delaney's phone buzzed. She looked at the screen and her expression did the thing expressions did when data arrived that confirmed what you'd suspected, but hoped was wrong. "Graft's current location pings to a cell tower 11 miles from here." She looked at Falco. "He made that call local." The parking lot felt slightly different after that. Not dangerous. There were 2 federal agents and a clear sight line in every direction. But charged, the way spaces became charged when the understanding arrived that a situation had active parts still in motion, that the people on the other side of it were not sitting passively somewhere waiting for consequences to reach them. "Go back inside," Delaney said. "Finish what you need to do with the dog. We'll come to you for the formal statement in 20 minutes. "I need more than 20. "How much more?" "Ranger goes into pre-surgical prep in 45 minutes. I need to be there for the handoff to the surgical team because he's not going to accept the transfer from anyone else without a significant incident, and a stressed dog with a hip fracture going into surgery is a worse surgical candidate than a calm one. Give me an hour. Delaney looked at her. Falco was already on another call, walking toward the far end of the lot with the focused body language of someone executing something that needed executing. 1 hour, Delaney said. Don't leave the building. I haven't left a building I needed to be in since I was 29 years old, Nora said. She went back inside. The strike was in the administrative corridor when Nora came through the internal door, and this time the positioning was not strategic. Strike was simply standing there with a tablet in her hand and the expression of someone who had been watching the parking lot through the window and had seen enough to understand that the situation in her facility was larger than she had initially calculated. There are federal agents in my parking lot, Strike said. Yes. Conducting an active investigation. Yes. And you knew they were coming before they arrived. Nora stopped. She looked at Strike directly, the same way she had looked at Delaney in the conference room, because Strike deserved the same directness and because the time for managed information was over. Yes, I knew a case I was involved in years ago was being reopened. I didn't know it would happen today at this facility, triggered by a specific patient intake. But yes, I knew this was possible. Strike absorbed that. You've been working here for 2 years, 26 months, and you didn't disclose. I disclosed my nursing credentials, my employment history, and my clinical experience, Nora said. The rest of my background is classified. I'm not being evasive about that. It is legally classified. There was nothing I was permitted to disclose. Strike set the tablet down on the corridor windowsill. She looked out at the parking lot and the federal vehicles and then back at Nora, and in her expression there was something that was not quite an apology, but was the nearest thing Strike's particular architecture of professional self-regard could produce, a recognition that she was standing next to something she had significantly underestimated and that the underestimation had not been neutral. What do you need from me? Strike asked. It was, Nora thought, the most useful sentence Strike had said to her in 26 months. I need the surgical suite prepped for Ranger's procedure. I need Dr. Ewan as the attending surgeon because Ranger has accepted him, and I need that surgical team to be stable. I need the pre-surgical timeline kept exactly as I've scheduled it, and I need you to keep the rest of the staff working normally so that this facility continues to function while federal investigators conduct their business here. That's all manageable, Strike said. Good. Nora picked up her pace toward the exam room, over her shoulder, and tell Brett to stay out of the East Corridor for the next 2 hours. She didn't hear Strike's response, but she heard the sound of the tablet being picked back up and footsteps going in the other direction, which was functionally what she needed. The pre-surgical handoff took 38 minutes. Nora talked Ranger through each phase of the transition the way she had learned to do in the rehabilitation unit, not with words exactly, because words were not the currency that mattered to a working dog in a clinical environment, but with proximity and pressure and the specific quality of unhurried attention that communicated to an animal trained to read human stress that the human currently responsible for him was not stressed. She was stressed. She was managing it through the same mechanism she had been managing it through since 5:30 this morning, which was the decision to do the next necessary thing and then the next necessary thing and not allow the accumulated weight of all the necessary things to land on her at once. Ewan came in scrubbed for the pre-surgical assessment. He was good under pressure. She had seen him manage a multi-trauma feline case 6 weeks ago with the steady procedural focus of someone who understood that panic was a luxury that cost more than it was worth. Today he moved through the hip fracture assessment with the same quality of attention, asking her questions when he needed information, not asking them when he didn't. The dynamic between them had shifted from the morning's careful professional politeness into something more functional, a working rhythm built fast under pressure because the situation required it. Drake was outside the pre-surgical room. He had been given a chair and had not sat in it. He was standing beside it with his arms crossed, and when Nora came out after the handoff, he looked at her with the direct, unmodulated look of a man who needed a straight answer and was going to stand there until he got one. He's in Ewan's hands, she said. The fracture is a surgical repair case, not a replacement. Ewan's going to stabilize the femoral head with internal fixation. The procedure itself is between 2 and 3 hours. Recovery starts immediately post-op. Is Ewan good enough for this? She looked at him. Yes? You're sure? I wouldn't have structured the handoff around him if I wasn't. Drake let out a breath that he had been holding since approximately 11 a.m. by her estimation. His shoulders dropped 3/4 of an inch. "Okay," he said. "I need to give a formal statement to the investigators," she said, "and I need to retrieve some documents. I'm going to be occupied for the next few hours, but I'll be back before Ranger comes out of surgery." "I'll be here," Drake said. She believed him. She went. The formal statement took 50 minutes. Nora sat across from Delaney and Falco in the conference room and reconstructed the graft call from beginning to end with the precision of someone who had been trained to retain and report verbal information accurately under pressure. She did not editorialize. She did not add texture she wasn't certain of. She gave them the call in the order it had occurred, flagged the specific moment his register had changed, and what she assessed as the intention behind the change, and answered their follow-up questions without padding the answers. When it was done, Delaney looked at her notes and then at Nora. "You're a good witness," she said. It was not a compliment in the warm sense, it was a professional assessment. "I've had a lot of practice observing things carefully," Nora said. "Not always by choice." Falco closed his notebook. "We've had a development in the last hour," he said. He looked at Delaney, who gave a small nod. "Graft was picked up 40 minutes ago. Traffic stop 11 miles from here, warrant executed concurrent. He's in federal custody." Nora kept her expression level. The information had weight, real weight, the kind that shifted the ground under you even when you were expecting it. But she let it settle without showing it. "He had a burner phone," Falco continued, "and a laptop. Digital forensics team is on both, but preliminary review shows recent communications with at least 2 other parties we've been tracking." "Harwick," Nora said. "One of the parties, yes." Falco paused. "The other is someone we haven't named publicly yet. A current officer. Active duty." The room shifted, not visibly. Nothing in the physical space changed. But the architecture of what Nora understood about the case rearranged itself around this new information and came out looking different. "The scheme is still active," she said. "Elements of it," Delaney said carefully. "We believe the core financial arrangement between Graft and Harwick has been dormant for 18 months, since the audit flagged the procurement irregularities. But there's evidence that the cover-up operation continued. Destruction of records, pressure on potential witnesses, strategic reassignment of personnel who were asking questions." "Active duty," Nora said again. She was processing this out loud, which she rarely did, but the information required it. "Which means someone with current access to base personnel records." "Yes." "Which means my phone number could have come from a personnel database rather than a private file." Delaney met her eyes. "That's our current working theory." Nora looked at the water stain on the conference room wall. Different stain than the hallway, same building, same fundamental problem. Systems that leaked, and nobody patched, until the damage was too visible to ignore. "How long before you have a name?" "That depends on what the digital forensics team pulls from Graft's devices in the next few hours, and it depends on what you can give us from your original evidence package." Delaney leaned forward slightly, "Which brings us to the next thing we need to discuss." "The documents," Nora said. "Where are they?" "One set is in a safe deposit box at a bank in Sacramento. One set is in a waterproof case in a storage unit I've maintained in Fresno for 12 years. The third set is..." She paused. "The third set is here, in this building, in the staff office at the end of the East Corridor." Falco looked up. "I brought them with me when I took the position here," Nora said. "I've kept them within reach for 26 months. Not because I was planning for this specifically, but because I have never been able to make myself put them somewhere I couldn't access inside of 20 minutes. Delaney was quiet for a moment. "Can we see them?" "Yes," Nora said. "Now." The staff office was exactly as she had left it. Calendar from 18 months ago, pushpin board, water stain near the baseboard, and underneath the false bottom of the bottom drawer of the filing cabinet, a modification she had made herself with a furniture panel, wood screws, and about 40 minutes of work on a Sunday evening 2 years ago. A fireproof document pouch approximately the thickness of a hardcover book. She put it on the desk. Delaney and Falco looked at it the way people looked at things they had been trying to reach for a very long time. She unzipped it. Inside, 47 pages of original documentation, each in a protective sleeve, photographs of facility logs showing dates of clearance, the corresponding medical records, and the financial transaction records she had obtained through a contact in base administration who had not known what he was giving her because she had framed the request as a routine cross-reference audit. A summary memo she had written herself in October of 2010, the night before she filed the complaint, detailing the scheme as she understood it in 3 structured pages of precise, jargon-free language. And on top of all of it, a single photograph. A clearance certification form signed, the contractor's signature at the bottom, the certifying officer's signature beside it. The certifying officer's signature was Major Dennis Harwicks. She had photographed it on a Tuesday afternoon in a records room she had accessed with a legitimately issued pass. She had not stolen anything. She had documented what was in front of her, returned the file to its place, walked out, and driven home. She had slept approximately 3 hours that night. Delaney put on fresh gloves and lifted the photograph by the corner. She looked at it for a long time. "This is Harwick's signature," she said. "Yes." "You're certain?" "I had seen his signature on 2 years' worth of unit documentation before I photographed that form," Nora said. "It's his." Falco was already on the phone with someone at the other end who was asking questions in a low, fast voice that she couldn't fully hear. She caught fragments, original document, certifying officer, chain of custody, and understood that whatever was being set in motion at the federal level, it had just moved from possible to certain. Delaney set the photograph down and looked at Nora. "When we prosecute this case," she said, "you will need to testify. You understand that?" "Yes." "It will be public." "Yes." "It will involve direct testimony about Victor Harwick, who is now a retired colonel with significant connections in the military and government contracting community." "I know who he is," Nora said. "I've known who he is since he signed the memo that ended my career in that unit." "There may be pressure campaigns," Delaney said. "Media, professional, possibly personal." "Agent Delaney," Nora looked at her steadily. "I have been living in Redwood Falls, California, working at an animal trauma center, eating cold gas station sandwiches at my locker, and being called furniture by a 24-year-old vet tech for 26 months. My life has already been under pressure for 14 years. What you're describing is something I can manage." Delaney was quiet. Then she said, "You didn't have to walk toward that dog this morning." "Yes, I did," Nora said simply. "He was in pain and nobody else was going to." The two agents spent 20 minutes cataloging the evidence pouch's contents, photographing each document in sequence, logging the chain of custody with meticulous attention. Nora watched and answered questions when asked. She had entered a mode she recognized from the rehabilitation unit, the mode of someone in the middle of something that required everything she had and who had therefore stopped spending energy on anything that didn't require it. She was thinking about Ranger's surgery. She was thinking about the 43 dogs. She was thinking about Victor Harwick in a congressional hearing room, which was where this was eventually going to go, and about what it would feel like to look at him across that kind of space after 14 years of looking at a water stain on a wall in a small office that nobody had officially assigned to her. She was not a person who ran on fantasies of vindication. That was not what had kept her moving for 14 years. What had kept her moving was simpler and less satisfying and more durable than vindication. It was the knowledge that she had been right, and that being right required you to keep being right, even when nobody around you was treating you that way. But she was human, and the thought of Victor Harwick in a hearing room did something to her chest that she allowed herself to feel for exactly the length of time it took Delaney to turn a page. Then she put it away. "I need to get back to the clinical floor," she said. "Ranger should be in surgery within the next 30 minutes. "We'll need the Sacramento and Fresno copies retrieved," Delaney said. "I have contacts for both facilities. I can make the calls this afternoon. You'll have them within 24 hours. "Good." Delaney stood, extended her hand. "Ms. Voss." Nora shook it. It was a firm, direct handshake, no performance in it. She left the office and the agents behind and walked back to the surgical wing. Ranger went into surgery at 1:17 p.m. Nora stood outside the surgical suite door and watched through the observation window as UN made the first incision. Ranger was under general anesthesia, vitals stable on the board above the table, his right hip shaved and prepped. The fracture, which had been invisible to everyone who had looked without imaging, was about to be seen and addressed and corrected. It was going to be painful on the other side, Recovery from internal fixation of a femoral fracture in a dog ranger's size meant weeks of controlled movement, physical therapy, careful monitoring. It was going to require the kind of sustained attention that the system which had created this injury had never provided. She would make sure he got it. Drake came to stand beside her at the window. He didn't say anything for a while. They both just watched Ewan work, the surgical team moving in the compressed, efficient choreography of a procedure going as planned. "I put in a formal complaint to the Inspector General 8 weeks ago," Drake said eventually. "After the second clearance, I told them something was wrong with the process. They acknowledged it, and I didn't hear back for 6 weeks." He paused. "Then they called and said the case had been assigned to a federal investigative unit. They didn't tell me why it went federal. They didn't tell me there were 43 other dogs." "They couldn't," Nora said, "not while the investigation was open." "I know." He watched Ewan make a controlled dissection through the tissue layers above the hip joint. "I just keep thinking about how long he was in pain while I was filling out paperwork." "You didn't stop," she said. "Most people would have taken the second clearance and let it go. You filed a complaint and kept pushing." She watched the surgical board. "That complaint is part of why this investigation has traction. Your documentation of Ranger's symptoms over 7 weeks, cross-referenced with the clearance records, is a direct evidentiary link in the chain." He looked at her. "That's a generous way to frame it." "It's an accurate way to frame it," she said. They stood in silence for another few minutes. On the surgical board, Ranger's heart rate was steady. The anesthesiologist noted something in her chart and made a small adjustment. Ewan was working at the hip joint now, the fracture site exposed, the path to repair laid out in front of him. Nora's phone buzzed. She looked at it. Not a call. A text from a number she recognized. The man she had called from the locked office that morning, the one who had been waiting 14 years for her to dial. Harwick's attorney filed a preemptive motion in federal court 40 minutes ago, trying to suppress your original complaint on classification grounds. Hearing scheduled for tomorrow morning, 9 a.m., Judge Arlene Peretz, Northern District. She read it twice. Then she texted back, "Does Delaney know?" 3 seconds. She does now. Nora pocketed the phone. Harwick had an attorney who had been ready to file a preemptive motion within hours of the investigation becoming active at her facility, which meant Harwick had known the case was being reopened before today, which meant someone inside the investigative structure had told him, which meant the active duty officer Falco had mentioned, the one with current access to base personnel records, was not just a co-conspirator in the original scheme. He was still operating, still feeding information, still running interference for a network that had existed for at least 14 years and had apparently not finished existing yet. She looked through the observation window at Ranger on the table and at Ewan's hands working carefully around the fractured joint, and she understood that the clean resolution she had been holding in the back of her mind, investigation, evidence, prosecution, done, was not the shape this was actually going to take. The hearing was tomorrow at 9. The motion, if granted, would suppress her original complaint and potentially sever the evidentiary link between 2010 and the current scheme. Without that link, Harwick was a retired officer who had made a single questionable administrative decision 14 years ago, and Graft was a contractor who had made some bad choices in isolation, and the 43 dogs were a systemic failure with no face attached to it. She needed to get to a phone and call someone who understood federal evidentiary suppression proceedings, and she needed to do it in the next 2 hours. And she was standing in a surgical observation corridor in a small animal trauma center in Redwood Falls, California, wearing stained scrubs. She pulled out her phone again. She was 3 digits into a number she hadn't dialed in 11 years when the door at the end of the corridor opened and Strike came through it at a pace that was not quite running. And behind Strike was Delaney. And behind Delaney was a man Nora had never seen before. He was in his 50s, military-bearing even in civilian clothes, the kind of face that had spent decades being unreadable and had succeeded. He had a federal identification badge clipped to his lapel and eyes that went to Nora immediately and stayed there. Strike said something, but Nora wasn't listening to Strike. She was looking at the badge, and at the name on it, and at the fact that the man wearing it was not an investigator. He was from the Judge Advocate General's Corps, military legal, and the expression on his face was not the expression of someone arriving to help. "Ms. Voss," he said. His voice was the voice of someone who had rehearsed what he was about to say. I'm here regarding the classification status of materials you've reportedly provided to federal investigators this afternoon. I need you to come with me. Behind him, Delaney's jaw was tight, in the way jaws went tight when something was happening that you had not been informed of and did not have the authority in this precise moment to stop. Nora looked at the JAG officer, at the badge, at the specific wording of what he had said. Classification status, not investigative matter, not federal case. And she understood with a cold, settled clarity exactly what Victor Harwick's attorney had filed in that motion. He was not trying to suppress evidence. He was trying to have it seized. "You're not seizing anything," Nora said. She said it without raising her voice. She said it the way she said most things that mattered, flatly, with the particular stillness of someone who had already done the calculation and arrived at the answer before the question finished being asked. The JAG officer, his badge read Lieutenant Colonel Warren Seiss, looked at her with the expression of someone who had been told this assignment would be simple. A nurse, a small facility, classified documents improperly disclosed, go in, invoke classification authority, recover materials, done. That was the assignment as he had understood it. He was recalibrating. "Ms. Voss, the documents you provided to federal investigators this afternoon may contain information classified at a level that requires—" "Those documents were classified at secret level when I was issued them in 2010, Nora said. "They were declassified under the standard 14-year automatic review provision in January of this year. I received written confirmation of the declassification status in March." She looked at him. "Do you want the confirmation letter, or do you want to call someone and verify it yourself?" "Either way, I can wait." Seiss stopped. Delaney behind him had not moved, but something in the set of her shoulders had changed. The particular shift that happened when information arrived that reorganized a situation in your favor, and you were professional enough not to show it yet. "The motion filed by Colonel Harwick's attorney," Nora continued, "argues that the materials are currently classified. That argument is factually incorrect. The declassification was processed through the National Declassification Center and is a matter of federal record. If Harwick's counsel filed that motion without verifying current classification status, they've made an error that the court will identify in approximately the first 3 minutes of tomorrow's hearing." She paused. "Or you can call the NDC right now and confirm it yourself, and we can skip the hearing entirely." Seiss looked at her for a long moment. Then he looked at Delaney. Then he looked at the badge on his own lapel as though it might provide guidance, which it did not. "I'll need to make a call," he said. "There's a conference room at the end of the administrative corridor," Nora said. "It's private." He went. His footsteps down the hallway had a different quality than they'd had coming in. Delaney waited until he was out of earshot. The declassification letter, in the same fireproof pouch, behind the summary memo. Nora looked at her steadily. "I told you I've had a long time to think about this. You knew he was going to try the classification angle. I knew Harwick was going to try every angle available to him. A man who spent 14 years suppressing evidence doesn't stop being thorough just because an investigation opens." She glanced toward the surgical suite. "How much time do we have before this gets in front of the judge?" "The hearing is 9 a.m. tomorrow, but if Seiss confirms the declassification status in the next hour, the motion gets withdrawn before it's heard. Harwick's attorney doesn't want to walk into court with a factual error of that magnitude on record." Delaney paused. "It damages credibility, and right now credibility is the only thing Harwick has left." "Then we have tonight," Nora said. "For what?" "For getting the Sacramento and Fresno copies transferred into federal evidence custody before anyone has another idea about how to complicate this." She looked at Delaney directly. "I want all 3 evidence sets under federal seal tonight. Not tomorrow. Tonight." Delaney considered this for approximately 4 seconds. "I'll make the calls." The surgical board showed Ranger's heart rate at 62 beats per minute at 2:41 p.m., which was where it should be for a dog of his size under controlled general anesthesia, and Nora stood at the observation window and watched the number and allowed herself to think about nothing else for exactly 4 minutes. This was a practice she had developed in the rehabilitation unit and refined in nursing school and used consistently ever since. The deliberate imposition of a narrow focus for a fixed period when the surrounding situation was large enough to be cognitively overwhelming. 4 minutes on the thing directly in front of her. 4 minutes of Ranger's heart rate and Yuan's hands working carefully at the hip joint and the clean, functional quiet of a surgical suite doing what it was designed to do. Then she went back to work. Drake was in the waiting area off the surgical corridor. He had found the chair this time and was sitting in it with his forearms on his knees and his hands loosely linked, the posture of someone running internal calculations that didn't require external input. He looked up when she came in. "Cease is on the phone in the conference room," she said. "He'll likely be done within the hour. The motion Harwick filed will probably be withdrawn before the hearing." Harwick filed a motion. Drake said it flatly, not a question. "To suppress my original evidence." He tried to invoke classification authority. She sat down in the chair beside his. It didn't work. Drake looked at the wall across from them, bare drywall, an institutional beige that nobody had ever believed in. He knew the investigation was being reopened. Yes, someone told him. Someone inside. That's what the investigators believe. They're working on identifying who. She looked at her hands for a moment. Graft had communications with at least 2 parties on his devices. Harwick was one. The other is an active duty officer with current base access. Drake's jaw moved. He didn't say anything for a moment, and she could see him working through the implications of that. Not abstractly, the way a civilian might, but with the specific texture of someone who had spent years operating in an environment where betrayal of this kind had real, named, consequential costs. "An active duty officer fed Graft your phone number," he said. "Most likely." "And fed Harwick the information that the investigation was active." "Yes." "And potentially fed information about witness locations, evidence locations." "We don't know the scope yet," she said. "The digital forensics team is still on Graft's devices." Drake looked at her. "Are you in danger?" She thought about the honest answer. "I don't believe so. The suppression motion failing removes the immediate incentive. Graft is in custody. And the moment SICE confirms the declassification status, Harwick's legal strategy collapses in a specific way that makes escalating to anything beyond legal maneuvering a very bad calculation for him." She paused. "He's not irrational. He got away with this for 14 years by being careful and calculating. He's not going to make a move that increases his exposure." People who have been careful and calculating for 14 years sometimes get desperate when the walls close in, Drake said. "Yes," she said. "They do. That's why all 3 evidence sets are going into federal custody tonight." Drake nodded once. He looked at the wall again. Then he said something that was not what she expected. "My wife left me 2 years ago," he said. "She said I cared more about Ranger's situation than I did about rebuilding a normal life after the service." He was quiet for a moment. "She wasn't entirely wrong. I spent 8 months filing complaints and appeals and making calls that went nowhere, and it cost me things I didn't fully account for at the time." He stopped. "I'm not sure why I'm telling you this." "Because the waiting is hard," she said. "And when waiting is hard, people say things they'd normally keep internal." "Is that a clinical observation?" "It's an observation from sitting in a lot of rooms with people waiting for hard outcomes." He almost smiled. "Not quite." "Fair." She looked at the surgical board through the observation window, heart rate steady. Yuan was working at the bone now, the internal fixation hardware being placed with the deliberate precision of a procedure going correctly. Not flawlessly. She had watched enough surgeries to know that flawless was a myth, that even excellent procedures had moments of adjustment and reapproach, and the quiet problem-solving that happened inside surgical suites and never appeared in the final report. But going correctly. Going the way it needed to go. "For what it's worth," she said, "the 8 months you spent filing complaints while everything else fell apart, that's in the evidence record. Your documentation of Ranger's symptom progression is some of the clearest clinical lay observation I've seen outside a trained medical context. You noticed the right things, and you wrote them down accurately, and you kept pushing when 2 clearances told you to stop." She looked at him. "That matters." He didn't answer. But something shifted in his posture, not dramatically, not a visible release, just a quiet internal adjustment, the kind that happened when a person received information that they needed and had not expected to receive. At 4:15 p.m., Lieutenant Colonel SICE came out of the conference room. He walked down the corridor to the surgical waiting area and stopped in front of Nora with the expression of a man who had made the call and gotten the answer he hadn't wanted, and was now doing the professional thing, which was handling it. The declassification status is confirmed, he said. The materials were processed through the National Declassification Center in January. The confirmation letter in your evidence pouch corresponds to an authentic NDC record. He paused. Colonel Harwick's counsel has been notified. The motion will be withdrawn before 9 a.m. Thank you for verifying it, Nora said. He looked at her for a moment. Something passed through his expression. Not an apology exactly, but the recognition that he had been sent to do something that turned out not to need doing, and that the person who had sent him had not done the due diligence that would have revealed this before he made the drive. For what it's worth, he said, I was told the classification status was current. I should have verified it independently before coming here. Yes, she said. You should have. She said it without heat. But you verified it when it counted. He left. Nora sat back in her chair and let herself feel the specific exhaustion of a body that had been running on adrenaline and procedural focus since 5:30 in the morning. It was not collapse. She wasn't done yet, not by a significant margin, but it was the first moment since she had watched the government truck pull into the parking lot that she had stopped moving long enough for her actual physical state to surface. Her right shoulder ached. She had a persistent low headache from the gas station coffee and the insufficient sleep. She was hungry in the distant informational way that happened when the body had been ignored long enough to stop sending urgent signals and had downgraded to reminders. Drake stood up. I'm going to find something from the vending machine, but he said. You want anything? She looked at him. Whatever's least terrible. He came back 8 minutes later with 2 packages of crackers and a bottle of water and a granola bar that had probably been in the machine since the previous quarter. He handed her the crackers and the water and kept the granola bar, which she thought was probably a fair assessment of the relative quality, and they ate in the waiting room beside the surgical corridor without talking, which was its own kind of conversation. At 5:52 p.m., Ewan came out of the surgical suite. He was still in scrubs, pulling his mask down. He was tired. She could see it in the way he moved, the slight drag of someone who had been standing and concentrating at high intensity for nearly 5 hours, counting the pre-surgical work. He looked at Nora first, which was not the habit of someone who had been at this facility long enough to have developed the reflex of looking at the client first. He had spent enough time today working alongside her that his read of the room had recalibrated. He's out, Ewan said. Procedure went as expected, fractures reduced and fixed. Hardware placement is good. I'm happy with the positioning. He's in recovery now, anesthesia reversing on schedule. Drake exhaled. Recovery is going to be the work, Ewan continued. 8 to 12 weeks of controlled exercise. We're talking structured physical rehabilitation, hydrotherapy if we can access it, careful progression. His muscle mass has compensated around the bad hip for long enough that we're going to have to essentially reteach his body how to load that joint correctly. He looked at Drake. He's going to need patience from both of you. He's got it, Drake said. He tolerated anesthesia better than I expected for a dog his age with his stress levels, Ewan said. That's a good sign. His baseline conditioning is excellent. The injury is the variable, not the dog. Can I see him? Drake asked. In about 20 minutes, when he's more alert. I don't want him waking up disoriented in an unfamiliar space without someone he knows nearby. Ewan looked at Nora. You too, if you're available. He's going to read the room when he comes around. I'm available, she said. Ewan went back through the door to finish the post-surgical documentation. Drake sat down. He put his face in his hands for a moment. Not crying, just the gesture of a person allowing a large amount of released tension to move through without requiring it to look like anything in particular. Nora looked at the wall and gave him the moment. Then her phone buzzed. Falco. She answered. Forensics pulled the second device, he said without preamble. There's a secondary communication chain on Graf's laptop. Encrypted, but not well enough. The active duty officer is identified. Name is Major Brett Ostrander, Fort Calloway Base Administration. She stood up. When did the communication start? Approximately 22 months ago, which tracks with the audit flag timeline. Ostrander was feeding Graf information about the audit's progress, names of personnel being interviewed, scheduled document requests. He's the reason several key witnesses at Fort Calloway were reassigned before investigators could formally interview them. Is he on base now? Base security is executing a detainment order as of 40 minutes ago. He was in his office. A pause. He tried to access the base records system to delete files approximately 8 minutes before the detainment order reached him. The system flagged the access attempt and locked him out automatically. Forensic imaging of the record system is running now. What did he try to delete? Personnel files. Specifically, yours. Your original unit assignment at Fort Meade, your complaint filing record, your discharge paperwork. Another pause, shorter. And Ranger's complete base veterinary file. She held that for a moment. He was trying to erase the evidentiary trail. Yes, he didn't succeed. But the attempt is itself evidence. It demonstrates consciousness of guilt and active obstruction in real time. Falco's voice was steady and professional, and underneath it there was the particular quality of a federal investigator who had just watched a case get significantly stronger, while the people on the other side of it got significantly weaker. Delaney wants you to know, we have enough for Harwick now. Not just the financial records and the clearance documents. Enough. Nora looked at the surgical suite door. Behind it, Ranger was coming out of anesthesia in a recovery bay. For the first time in more than a year, he was going to wake up in a body that was in the process of being repaired rather than a body that had been enduring damage that nobody acknowledged. "Thank you," she said. She pocketed the phone and turned to Drake. He had looked up when she stood. He was reading her face the way he had been reading situations all day. Fast, direct, with the practiced assessment of someone trained to extract accurate information from imprecise signals. "Tell me," he said. She did. Concisely, in the order it mattered. Active duty officer identified. Detainment executed. Deletion attempt failed. Evidence sufficient for Harwick. Drake listened without interrupting. When she finished, he was quiet for a moment. "It's over?" he asked. "The investigation phase isn't over," she said. "There will be hearings, prosecution. It's going to take time." She looked at him steadily. "But the part where they could make it disappear, that part is over." At 6:40 p.m., they brought Ranger out of recovery. He was groggy and slow, the way dogs were coming out of anesthesia. Not distressed, just processing a body that felt different than it had an hour ago. His right rear leg was bandaged and splinted for the immediate post-surgical period, and he moved with the careful uncertainty of an animal whose pain signals were currently muffled by medication and who had not yet fully mapped what his body was doing. He registered Drake first. His tail moved, slow, deliberate, not the sharp alert signal of a working dog on task, but the lower, more fundamental communication of an animal recognizing something that mattered. Drake sat on the recovery room floor beside him and put his hand on Ranger's chest and didn't say anything for a while. Ranger put his chin on Drake's knee. Nora stood near the doorway and watched, and made herself stay there rather than going to Ranger's other side, because this was not her moment, and she knew it. She had her own version of this moment. It was quieter, and it was entirely internal, and it happened while she stood in the doorway watching Drake's hand on Ranger's ribcage. 14 years of being right about something that nobody would confirm. 14 years of the copies in the fireproof pouch, and the storage unit in Fresno, and the safe deposit box in Sacramento. 14 years of folding tables and cold sandwiches, and being furniture that could take blood pressure readings. A dog had walked through a door this morning and stopped in front of her. And now, because of that, because of this specific sequence of events beginning with a Belgian Malinois with a notched ear recognizing something in her that his training had encoded and his instinct had retrieved, a network of fraud that had caused real harm to real animals for nearly a decade was collapsing in real time across multiple federal jurisdictions. She was tired. She was satisfied in a way that was not triumphant, quieter than triumph, more settled. She was already thinking about the deposition she would need to give, the formal witness preparation, the timeline of prosecution, the thing Delaney had said about pressure campaigns, and what she would need to be ready for. But for this specific moment, in this specific doorway, she let it be what it was. Her phone buzzed one more time. She looked at the screen. Unknown number, not California, DC area code. She stepped out of the recovery room and answered. "Nora Voss," she said. The voice on the other end was not Delaney, not Falco, not the man she had called from the locked office that morning. It was a woman's voice, older, with the particular measured cadence of someone who had spent decades being precise. "Miss Voss, My name is Margot Ellison. I'm the Deputy Inspector General for the Department of Defense, Investigative Operations Division. A brief pause. I've been briefed on today's developments in your case. I'm calling personally because there's something I need you to know before tomorrow. Nora leaned against the corridor wall. I'm listening. The evidence you preserved from 2010, in combination with the digital forensic material recovered today from Wendell Graff's devices, has triggered a mandatory referral to the House Armed Services Committee. Another pause. We've been asked to provide a preliminary briefing to the committee chair's office at 7 a.m. tomorrow before the court hearing. That briefing will reference you by name as the originating complainant. I understand. What I need you to understand, Ellison said carefully, is that Victor Harwick was not operating alone in the suppression of your 2010 complaint. We've identified 2 additional signatories on the internal memo that classified your complaint as unsubstantiated. One of them is currently serving in an advisory capacity to the Secretary of Defense. The corridor was very quiet. His name, Ellison said, is Raymond Kolbeck. Nora knew that name. She had known it for 14 years. It had been in her summary memo, the 3 structured pages she had written the night before she filed, present at one of the contractor reviews she had observed, present in the records room on the day the documentation had disappeared, present in the corner of a room during a meeting that he had assumed was private because he had looked at her and seen no one worth accounting for. She had written his name down. She had put it in the fireproof pouch. She had carried it for 14 years. He'll be at the committee briefing tomorrow, Ellison said, as a DOD advisor. He doesn't know yet that the referral names him. Nora looked at the recovery room door. Through it, Drake and Ranger. Through the building, Delaney and Falco, and the evidence already in federal custody. In Sacramento and Fresno, 2 more sets of copies moving toward federal seal. In a federal holding facility somewhere, Wendell Graff, who had started talking the moment his attorney arrived and had not stopped. And in Washington, D.C., a man who had stood in the corner of a room 14 years ago and looked at a junior member of a classified unit and seen furniture. Miss Voss, Ellison said, are you available to join the committee briefing by secure video conference at 7 a.m. tomorrow? The question was not complicated. The answer had been determined 14 years ago, the moment she sat down in front of a computer in a records room with a camera and photographed a signature on a clearance form. Yes, she said, I'm available. Good. Ellison paused. One more thing. The committee chair has specifically requested your original 2010 summary memo. He described it, and I'm quoting directly, as the clearest documentation of a systemic institutional failure he has read in 22 years on that committee. Nora looked at the wall. Tell him it was written in 3 hours on a Tuesday night, she said, by someone who knew nobody was going to read it, but wrote it carefully anyway. She ended the call. She stood in the corridor for a moment. Then she pushed off the wall and went back to the recovery room, where Ranger was lifting his head from Drake's knee with the slow, exploratory alertness of an animal coming back to itself. And Drake was watching him with the expression of a man who had been bracing for a long time and had just, quietly, stopped. She sat down on the floor on Ranger's other side. He looked at her with the direct amber focus of a dog doing an assessment. She put her hand on his shoulder and he accepted it. Hey, she said quietly. His tail moved once, then again, slow and real, and there. Her phone was in her pocket with the D.C. area code still on the recent call screen. And tomorrow morning at 7 a.m., a man named Raymond Kolbeck was going to walk into a committee briefing room in Washington with no idea that the summary memo he had dismissed 14 years ago was going to be read into the congressional record by the committee chair before he had finished his first cup of coffee. She did not know this for certain. She did not know exactly how tomorrow would go, or the day after, or the weeks of depositions and hearings and press coverage that Delaney had warned her about. She did not know how many of the 43 dogs had people who had been fighting for them the way Drake had fought for Ranger, or how many had been alone in their pain without anyone who noticed. She knew that Ranger's heart rate was 68 and stable. She knew that the hardware in his hip was correctly placed and the fracture was reduced. She knew that she had 3 sets of documents in federal custody and a declassification letter and a 14-year-old summary memo that a congressional committee chair had called the clearest documentation of systemic institutional failure he had read in 2 decades. And she knew that at 7 a.m. tomorrow, Raymond Kolbeck was going to find out that the furniture could talk. She did not sleep well. That was the honest accounting of it. She drove home at 9:47 p.m. on roads she knew well enough to navigate without full attention, which was fortunate because she did not have full attention to give. The truck's heater was still unreliable, and the coastal fog had come in thick, and she drove with both hands on the wheel and her mind running the same sequence on a loop. Ellison's voice, the name Raymond Kolbeck, the 7 a.m. briefing, the congressional record. She was not anxious exactly. She was in the state that preceded very large things, the state where your body understood what was coming and declined to let you fully rest in preparation for it. She got home at 10:15. She ate standing at her kitchen counter, crackers and the remainder of a rotisserie chicken she had bought 3 days ago and a glass of water. And she sat at the small table by the window and opened her laptop and spent 40 minutes reviewing the summary memo she had written 14 years ago, reading it the way you read something after a long absence, checking whether it still said what you remembered it saying. It did. It was precise and structured, and it did not use a single word it didn't need. She had been 29 and frightened and furious, and she had sat down at a computer and written 3 pages that contained exactly what they needed to contain and nothing that they didn't. Reading it now, she felt something for that version of herself that was not quite pride and not quite grief. A kind of recognition. The acknowledgement that the person she had been that Tuesday night had done the work correctly under conditions that did not deserve correctness, and that the correctness had survived 14 years waiting to matter. She closed the laptop at 11:47. She set an alarm for 5 a.m. and lay down on her bed in her clothes and closed her eyes and was asleep in 4 minutes, which was what exhaustion eventually produced regardless of the noise in your head. The secure video connection established at 6:58 a.m., Nora was at the folding table in her living room, laptop open, dressed in the only blazer she owned, dark navy, purchased 3 years ago for a job interview she had ultimately not attended. Behind her was a plain wall. She had moved 2 stacks of books and a dying plant out of frame. The briefing room came up on her screen. A long table, wood-paneled walls, the particular institutional formality of a congressional office building. 6 people seated. Margot Ellison at one end, 2 aides beside her. The committee chair, a man in his late 60s named Representative Gerald Okafor, who had the broad face and deliberate manner of someone who had sat through enough briefings to have stopped performing attention and simply paid it, at the center. 2 additional committee members to his right, and at the far end of the table, slightly apart from the others, in the specific way that people were apart when they did not yet understand they were separated, Raymond Kolbeck. He was 63 years old. She knew that from the research she had done over the years when she allowed herself to do it, which was rarely. He had the comfortable authority of someone who had spent 40 years being listened to, gray at the temples, a good suit, the particular physical ease of a man who had never had sustained reason to be physically uncertain. He was looking at the papers in front of him when the screen connected. He did not look up immediately. When he did, his eyes moved across the video conference panel and landed briefly on Nora's face and moved on. She was a small rectangle on a large screen. She was remote. She was, in the visual grammar of this room, peripheral. He had not yet read the morning's briefing document. She could tell, because if he had read it, his eyes would not have moved on. Representative Okafor opened the session without preamble, which she respected. He stated the purpose of the briefing, the mandatory committee referral triggered by the Fort Calloway investigation, the scope of the evidence presented, the timeline of the scheme is currently documented. He spoke for 6 minutes in the organized, evidence-grounded manner of someone who had done the reading the night before and remembered it accurately. Then he said, "Ms. Voss, thank you for joining us on short notice. I'd like you to walk the committee through the 2010 complaint and the circumstances of its suppression, in your own words, starting from the beginning." Nora looked directly into the camera. In September of 2008, she said, "I was assigned to a classified military working dog rehabilitation unit at Fort Meade. My role was clinical monitoring and rehabilitation protocol management for dogs returning from deployment with complex injuries or behavioral sequelae. In my first year, I worked under 3 supervising officers, none of whom are named in this investigation. In my second year, I began observing irregularities in the medical clearance process for dogs being transitioned to retirement status." She spoke for 22 minutes. She did not use notes. She had carried this sequence of events in her memory for 14 years with the specific fidelity of someone who had returned to it repeatedly, not as a comfort, but as a commitment. Making sure the details remained precise, making sure nothing softened or shifted in the way memories shifted when they were not actively maintained. She named dates. She named document reference numbers. She named the contractor she had observed conducting irregular reviews, not Graft, the man who had recruited him. And she named the specific clearance certifications she had photographed, the specific medical record she had documented as altered, and the specific moment she had watched a dog she had worked with for 11 weeks be certified as fit for a service category that his imaging, which she had reviewed, showed he could not physically sustain. She named Major Dennis Harwick. She described the memo she had received following the complaint, 3 paragraphs, formally worded, informing her that the complaint had been reviewed and found unsubstantiated, and that her clearance for the unit would not be renewed. She described leaving Fort Meade on a Thursday in October, carrying a box of personal items and a copy of every document she had preserved. At the 14-minute mark, she watched Raymond Kolbeck look up from his papers for the second time. This time his eyes did not move on. He had found his name in the briefing document. She could see the exact moment it happened in the change in his posture. The barely perceptible shift of a man whose body registered a threat before his expression could organize a response. He looked at the video panel. He looked at her face on the screen, and in his expression, for approximately 2 seconds before he recovered it, she saw the thing she had seen in the records room 14 years ago. The look of a person who had processed her as irrelevant, who had looked at her and made a calculation about how much weight her presence warranted, and who was now doing a very different calculation about how wrong the first one had been. She kept talking. She did not change her tone or her pace. She had not been waiting 14 years for a dramatic moment. She had been waiting for this information to be in the right room with the right people, and it was, and that was enough. When she finished, Representative Okafor thanked her. Then he looked at the end of the table. "Mr. Kolbeck," he said, "the briefing document includes a declassified internal memo bearing your signature, authorizing the classification of Ms. Voss's 2010 complaint as unsubstantiated and sealing it from further review. I'd like to understand the basis for that determination." The room was quiet, the particular quiet of a space where everyone present understood that what was about to be said mattered, and were waiting for it. Kolbeck's attorney, who had been seated against the wall, and who Nora suspected had also not expected to need to speak this morning, leaned forward and murmured something. Kolbeck held up a hand. "Representative Okafor," he said. His voice was controlled. "I'd like to request an opportunity to consult with counsel before responding to questions about specific documents." "That's your right," Okafor said. "The committee notes the request for the record." It was noted. And the fact that it was noted that Raymond Kolbeck, current DOD advisor, had sat in a congressional briefing room and declined to explain a document bearing his signature in the context of a federal fraud and obstruction investigation, was itself a record that would be read and cited and built upon in every subsequent proceeding. Nora looked at him through the screen for a moment. She did not feel triumphant. She had expected not to. What she felt was the specific, settled quality of something that had been waiting in the correct position for a very long time finally being allowed to land. Then she looked at Representative Okafor. "Is there anything else you need from me at this time?" "Not at this time, Ms. Voss. We'll be in contact through the IG's office for formal deposition scheduling." He paused. "And I want to say, on behalf of this committee, that the quality of the documentation you preserved, under the circumstances under which it was preserved, is extraordinary. The fact that this evidence exists in the form that it does is entirely a function of the care you took 14 years ago, when you had every reason to believe no one would ever look at it." Nora was quiet for a moment. "Someone always looks eventually," she said. "You just have to make sure the documentation is still there when they do." She closed the laptop. The drive back to Redwood Falls Animal Trauma Center took 40 minutes. She spent the first 20 of them in the particular silence of someone who has just completed something very large and has not yet worked out what comes next. She stopped at the gas station at the highway interchange and bought a coffee and a breakfast sandwich and ate both of them in the parking lot before pulling back onto the road. Because she was hungry, and she had learned a long time ago not to treat her own basic physical requirements as optional. The facility parking lot was fuller than usual when she arrived. She noticed the additional cars without immediately understanding them. 2 vehicles she didn't recognize, one of which had a press identification tag hanging from the rearview mirror. She went in through the staff entrance. Delaney was in the administrative corridor, which was where Nora had begun to think of as Delaney's natural habitat in this building. Falco was on the phone near the window. The quality of energy in the corridor was different from the previous day, less pressurized, more purposeful. The difference between the hours when the situation was still uncertain and the hours after the structure had been determined and the work of executing it had begun. "How was the briefing?" Delaney asked. "Productive," Nora said. Colbeck declined to speak without counsel. Delaney nodded as though this confirmed something she had expected. His attorney called the IG's office 40 minutes after the briefing ended. Colbeck is going to cooperate in exchange for a negotiated agreement. His attorney is framing it as acting under pressure from Harwick, which may be partially true. She paused. Partially. "He signed the memo," Nora said. "Whatever pressure he was under, he signed it." "Yes, he did." Delaney looked at her evenly. The cooperation agreement doesn't eliminate accountability. It shapes the form of it. What does that mean in practical terms? It means Colbeck's testimony will be used to build the case against Harwick at the highest level. And in exchange, Colbeck faces administrative termination from his DOD advisory position, mandatory referral to the DOJ for misuse of classification authority, and a formal censure in the congressional record. She paused. His career in government service is finished. He will not face criminal prosecution if his cooperation is complete and accurate. That's the negotiated boundary. It was not everything. She had known it wouldn't be everything. That was not how these things worked, and she was not naive enough to have expected otherwise. But it was real. And it was named. And it was in the congressional record. "Harwick," she said. "Federal grand jury convened this morning," Delaney said. "The charges being pursued are fraud against the government, conspiracy to commit wire fraud, obstruction of justice, and abuse of military authority. His counsel has indicated he will contest." She looked directly at Nora. "He's going to fight it." "He can fight it," Nora said. "The evidence is in federal custody." "All 3 sets confirmed, received, and logged as of 2 a.m., Falco said, lowering his phone. "Sacramento, Fresno, and the original pouch. Chain of custody is clean." "And graft," Nora said. "Full cooperation agreement signed at 11 p.m. last night. He's providing testimony against Harwick and Ostrander, both. His criminal exposure is significant enough that his attorney advised full disclosure, which is what we're getting." Falco paused. "He also confirmed something we suspected but hadn't yet documented. Harwick had been aware of your specific location and employment for the past 3 years." The corridor was quiet. "He knew I was here," Nora said. "Yes. For 3 years. Yes." She thought about that, about the 26 months of folding table and gas station sandwiches and being called furniture. About whether any part of that period had been shaped by someone deciding she was contained enough, managed enough, far enough from anything that mattered to be allowed to continue without intervention. About whether the very smallness of her life here had been, in some perverse way, her protection, that she had been invisible enough that disrupting her had not seemed worth the risk of drawing attention. She thought about this dog walking through the door yesterday morning, the specific accident of Ranger's intake, Ranger's fracture, Ranger's instinct. The chain of events that had started not with her decision, but with a Belgian Malinois doing the thing his training had built into him, reading a person accurately when everyone around him had failed to. "He underestimated me," she said. "For 3 years he knew I was here, and he decided I wasn't a threat worth managing." "Yes," Falco said. "That's the same mistake he made in 2010. "Yes," Delaney said. "It is." Nora picked up her staff badge from the desk where she had left it the previous evening. She clipped it to her scrubs. "I need to check on Ranger," she said. "Then I'll be available for whatever you need from me today." Ranger was awake. More than awake. He was alert in the contained, measuring way of a working dog whose instincts had not been diminished by surgery or medication or a year of managed pain. He was in the recovery kennel, lying on a padded surface with his bandaged leg elevated on a foam wedge. And when Nora came through the kennel door, his ears came up and his tail moved in the deliberate sweep that she had come to understand was his specific greeting for her. Different from how he greeted Drake. Different from how he acknowledged Ewan. something he had assigned to her specifically in the taxonomy of people he had decided to trust. She crouched beside the kennel and put her fingers through the mesh. He pressed his nose against them. "Good morning," she said. He breathed out slowly, the sound of a dog not in acute crisis for the first time in a very long time. She went through his overnight chart. Temperature stable. Pain scale observations from the night technician were consistent with a post-surgical patient whose medication was calibrated correctly. Not comfortable, exactly, because there was no comfortable 2 days after hip fixation surgery, but managed. Manageable. The difference mattered. Drake was in the kennel facility waiting area at 7:45 when she came out. He had clearly slept in the facility. She could tell from the specific dishevelment of someone who had tried to sleep in a chair and succeeded partially, and from the coffee cup in his hand that came from the staff machine, which meant someone had let him into the staff area, which meant either UN or one of the night techs had made the judgment call that a man who was not going to leave deserved at minimum access to the coffee machine. She respected that judgment call. "He looks better," Drake said. "He is better," she said. "The medication is doing its job. The hardware is in the right place. His vitals overnight were stable." She sat down across from him. "The hard part starts now. Recovery at this level requires consistent, structured work. Hydrotherapy, controlled exercise progression, monitoring his weight distribution as he relearns the correct loading pattern." "I know," Drake said. "I've been researching it since 3 a.m. She looked at him. "You should sleep." "I will. Later." He looked at his coffee cup. "I heard there were press vehicles in the parking lot this morning." "Yes." "How public is this going to get?" "Harwick's indictment will be public," she said. "Ostrander's detainment is already in the public record through the base communications channel. Graf's cooperation agreement will become public when the prosecution moves forward." She paused. "It's going to be in the news." "Probably significantly." Drake was quiet for a moment. "And you?" "And me," she agreed. "How do you feel about that?" It was not the kind of question she had been asked often. People who asked how she felt about things were usually asking because they had a stake in the answer, or because they wanted her to say something that would make them comfortable, or because the question was procedurally required. Drake asked it the way he had said most things. Directly, without decorating it, actually wanting to know. "I feel like it's necessary, and I feel like it's going to be exhausting," she said. "Both of those things are true at the same time." He nodded. "Fair. What I care about is that the 43 dogs are named," she said. "Not as a statistic in a fraud case. Named. Each one with their service record and their injury and the specific certification that failed them. I want them in the public record as individuals." She looked at him. "That's what I'm going to push for through the IG's office and through the committee. That's the thing I'm not going to let become a footnote." Drake looked at her for a long moment. "You've been planning this part too," he said. "I've been planning every part," she said, "for 14 years. The only part I didn't plan was yesterday morning." "Ranger walking through the door. Ranger walking through the door," she confirmed. Drake looked at the kennel facility door. Beyond it, his dog was awake and alive and beginning the slow work of recovery. "I filed that IG complaint because I was out of options," he said. "I tried the base vet chain, the unit command structure, the standard appeal process. Filing with the IG felt like shouting into a room where nobody was going to hear me." He paused. "I didn't know it was going to end up here." "It doesn't usually," Nora said. "Most of the time it doesn't. Most of the time, the complaint goes into a file, and the file goes onto a shelf and nothing changes." She looked at him directly. "That's not a reason not to file it. You file it because it's the right thing to do, and because occasionally, someone is already holding the other end of the thread. And when that happens, what you filed is the thing that connects everything." He was quiet for a moment. "You were holding the other end." "For 14 years, she said. The story broke nationally at 11 a.m. on a Thursday, which happened to be exactly 1 week after a retired military K-9 had come through the doors of Redwood Falls Animal Trauma Center on a government-plated truck. The initial reporting was accurate in its broad strokes and incomplete in its details, which was the nature of initial reporting. It named Harwick, named the Fort Calloway scheme, named Graf's cooperation agreement and Ostrander's detainment. It described the congressional briefing and Colbeck's declination to speak without counsel, which several outlets framed in terms that were more direct than Colbeck would have preferred. By the following morning, the detailed reconstruction had appeared. The timeline of the scheme, the 43 dogs, the 7 who had died, the financial records, the falsified certifications. And in the middle of all of it, described in terms that Nora had not written and could not fully control, but that were, she had to acknowledge, accurate. A nurse at a small animal trauma center in Northern California, who had filed a complaint 14 years ago, had it buried, left the military, and had spent the intervening years keeping the evidence alive in 3 separate locations until the investigation she had been waiting for finally arrived. The calls started that afternoon. Media, first. Then the IG's office with the formal deposition schedule. Then 2 attorneys she didn't know, representing parties she hadn't expected, asking preliminary questions in the careful language of people assessing terrain. Then, at 4:43 p.m., a call from a number she recognized, the Rehabilitation Unit veteran network she had maintained a peripheral connection to for 12 years, a loose informal structure of people who had worked in the same classified space and kept loose informal track of each other. The man who called was named Howard Pruitt. He was 61, retired, and he had known her at Fort Meade in 2009 when she was junior staff and he was a supervising veterinarian, and he had not known what she had been building toward when she left. "I saw it this morning," he said. "All of it." "I know," she said. "I knew something was wrong in that unit," he said. His voice was rough with something that was not quite guilt but lived in the same neighborhood. "I saw the documentation anomalies. I didn't follow them far enough." "Howard, I should have." She was quiet for a moment. "You were also junior enough to be at risk," she said. "You had different calculations to make." "That's a generous accounting." "It's an accurate one." She meant it. She had not spent 14 years in bitterness toward the people who had not acted, only toward the people who had actively suppressed. There was a difference, and she maintained it precisely because blurring it would have cost her something she needed to keep intact. "What do you need?" "I want to testify," he said. "If they'll take it. I have documentation of the anomalies I observed. I didn't know what they meant at the time, but I know what they mean now." He paused. "And I want it on the record that what you did, what you've been doing, I want it on the record that it mattered." "It will be," she said. "Call Delaney's office. I'll tell them you're coming." 3 weeks after the story broke, Wendell Graft formally entered a cooperation agreement with the federal prosecution. His testimony covered 9 years of the scheme's operation in granular detail: the payment structure, the clearance process, the identity of every officer who had been involved in the certification chain. He named 4 additional individuals beyond Harwick, Ostrander, and Colbeck, 2 of whom had already retired from service, and 1 of whom was currently employed as a compliance officer for a defense contracting firm, which was the kind of detail that sent certain congressional offices into a particular kind of controlled fury. Graft faced federal fraud charges, conspiracy charges, and charges related to the deaths of the 7 dogs whose untreated injuries had been directly traceable to his certifications. His cooperation agreement reduced but did not eliminate his criminal exposure. His attorney argued strenuously for a suspended sentence given the cooperation. The prosecution argued strenuously against it. The outcome would be determined by a judge who had read the full evidence package and who had, according to Falco, described the Graft case as among the most clearly documented examples of sustained institutional fraud he had encountered in his career on the bench. Victor Harwick contested every charge. His legal team filed 4 separate motions in the first month, all of which were denied. They attempted a character witness strategy that collapsed when 2 of the witnesses withdrew after being informed that their own tangential connections to the scheme were now under review. They attempted to argue that the 2010 complaint had been classified in good faith based on genuine national security concerns, a position that the declassified documentation and Colbeck's subsequent testimony rendered factually untenable. At the formal indictment hearing, Harwick entered the courtroom as a retired colonel with 40 years of military service and the bearing of someone who had never been required to account for himself in a room where he did not control the terms. He left it as a defendant facing fraud, obstruction, conspiracy, and abuse of authority charges with a trial date set and a legal team that had stopped projecting confidence and started projecting careful management. His career in any meaningful sense was over. The specific shape of what came next was still being determined by a legal process that would take months. But the thing that had taken Nora 14 years to get to the right room had arrived in the right room, and there was no version of the evidence that allowed for a different conclusion. Ostrander was administratively separated from the military pending criminal prosecution on obstruction and conspiracy charges. The deletion attempt, 8 minutes before detainment, unsuccessful, logged in real time, had been presented to the grand jury as evidence of consciousness of guilt in terms that required no interpretation. Colbeck's administrative termination from his DOD advisory position was processed quietly, the way these things were processed when the institution preferred not to draw additional attention to how long someone had been advising it under the circumstances that were now public record. The congressional censure was not quiet. It was entered into the record in terms that were specific, named, and permanent. Howard Pruitt's testimony was accepted by the prosecution and entered into the evidentiary record. His documentation of the anomalies he had observed at Fort Meade in 2009 and 2010 provided corroboration for several elements of Nora's original account that had previously rested on her testimony alone. It was not the most dramatic piece of evidence in the case, but it mattered, and it was there, and Nora had told him it would be. 6 weeks after the story broke, the Department of Defense announced a comprehensive review of the military working dog retirement clearance program. Mandatory imaging requirements for all dogs transitioning to retirement status, independent veterinary oversight, and a formal reevaluation protocol for every dog currently in the affected program's retirement pipeline. The announcement was 4 paragraphs in a departmental press release. It was not the leading headline of the day, but Nora read it 3 times at her folding table before her shift began, and she kept the page open on her screen for the rest of the morning. Ranger's first hydrotherapy session was on a Tuesday, 5 weeks after surgery. Nora was there. Drake was there. Ewan came in on his day off, which he would not have admitted to doing deliberately, but which he also did not pretend had been an accident. The therapy pool was at a specialized facility 20 miles from Redwood Falls, a clean, functional space run by a physical therapist named Gina, who had worked with military working dogs for 8 years, and who, when Drake had explained Ranger's case in their intake consultation, had listened carefully and then said, "Let me see his imaging," and had spent 20 minutes with the surgical reports before she said anything else. Nora respected her immediately. Ranger went into the water with the specific wariness of an animal encountering an unfamiliar medium and making a rapid assessment of it. He was not afraid. Fear was not in his operational vocabulary in any sustained way, but he was cautious, which was appropriate. The buoyancy took the weight off his right hip in a way that Nora could see registered somewhere in his body as relief. His movement in the water was different from his movement on land. Freer, less compensatory. He figured out what was being asked of him within 4 minutes. He was that kind of dog. Gina watched him move through a controlled lap of the pool with the focused attention of someone doing a functional assessment and said, "His muscle atrophy on the right side is significant. We're looking at 12 weeks minimum, probably 16 for full functional recovery. But his drive is good. That's the variable you can't train into an animal. Either it's there or it isn't." "It's there," Drake said. "I can see that," she said. Nora stood at the pool edge and watched Ranger move through the water with the careful, deliberate effort of an animal doing difficult work and choosing to do it anyway, and she felt something that she did not immediately have a name for. It was not simple happiness, though there was happiness in it. It was the specific satisfaction of having stayed with something long enough and carefully enough that it became something real, that the copies in the fireproof pouch and the 14 years of distance and the folding table and all the cold sandwiches had accumulated into this, had resulted in this specific dog in this specific pool, beginning this specific work of recovery. She was not the reason Ranger existed. She was not the reason he had survived a year with an untreated fracture. She was not the reason Drake had kept filing complaints when every institutional response told him to stop. But she was the reason the evidence had been there when it needed to be. And she was the reason a fracture that everyone had missed had been found. And she was the reason the thread had connected. Sometimes that was what you were. Not the whole story, just the person who kept the thread. The formal ceremony was not her idea, and she agreed to it reluctantly, and then showed up anyway because refusing it entirely would have made a statement she didn't intend to make. It was held at the Redwood Falls Animal Trauma Center on a Friday afternoon, 9 weeks after the story broke. organized by the IG's office in coordination with a veterans advocacy organization that had adopted the military working dog cause as a central issue in its public policy work. There was a small podium in the main reception area. There were folding chairs. There were 11 people from the press and 7 from various federal and veterans organizations and the full staff of the trauma center, including Brett, who stood in the back and was very quiet and did not make eye contact with anyone. Representative Okafor attended by video. Delaney and Falco were present in person. Howard Pruitt drove up from Sacramento. Drake stood near the front with Ranger beside him. Ranger wearing a service vest for the first time in months, moving on his repaired hip with a gait that was still not fully symmetrical, but was measurably, demonstrably better than it had been 6 weeks ago. Strike introduced Nora with a speech that was more gracious than it needed to be and more accurate than Nora had expected, and which included a sentence that acknowledged that Nora's contributions to the facility had not always been recognized in proportion to their value, which was the closest thing to an institutional apology that institutional language could produce, and which Nora accepted without comment. Representative Okafor spoke about the committee's findings. He read into the record the names of all 43 dogs in the affected program. Each name, each service record, each documented injury. He read them in a flat, even voice without theatrical weight, because the weight was already there and didn't need to be performed. When he was done, the room was quiet for a moment in the way rooms were quiet when something real had just been said. Then he looked at the camera and said, "Jane, Ms. Voss, in 2010, you filed a complaint that was classified as unsubstantiated and sealed by people who understood what it meant and chose to suppress it anyway. You preserved the evidence at personal and professional cost for 14 years. And you continued to do the work, the daily, unglamorous, essential work of caring for animals in pain, while waiting for the moment when that evidence could do what it was meant to do." He paused. "On behalf of the House Armed Services Committee, I want to formally acknowledge that you were right. You were right then. You remained right for 14 years. And the record of this investigation will reflect that in permanent, specific, unambiguous terms." Nora stood at the podium. She had 3 sentences prepared. She had written them at her kitchen table at 6 a.m. that morning and had crossed out 4 previous versions because they were either too much or not enough. "The 43 dogs in this case did not have voices in the rooms where decisions were made about them," she said. "They had people, handlers, trainers, the staff of facilities like this one, who were supposed to translate their condition into language the system could act on. That translation failed for a long time. I want this case to be the reason it fails less often going forward." She stopped. "That's it. That's what I wanted to say." She stepped back from the podium. Ranger, from his position beside Drake, looked at her across the room with the direct amber focus that had not changed since the first moment in the reception area 9 weeks ago. His tail moved once, slowly, the flag acknowledgement she had come to recognize. She looked back at him. There was no version of what came next that was clean or easy or arrived without cost. Nora understood that with the same practical clarity, she understood most things. The prosecution of Victor Harwick would take 18 months and involve 17 days of trial and a defense strategy that was aggressive and expensive and ultimately unsuccessful, resulting in guilty verdicts on fraud, obstruction, and abuse of authority charges and a federal sentencing of 9 years. His attorney filed 2 appeals. Both were denied. Graft received a sentence of 4 years with the possibility of reduction for the quality of his cooperation, which his attorney argued was extensive, and the prosecution argued was minimally sufficient. The judge set the sentence at 4 years and noted in his remarks that the existence of a cooperation agreement did not diminish the nature of the conduct it was purchased with. Ostrander was convicted on obstruction and conspiracy charges and separated from the military with a dishonorable discharge. He served 2 years before his sentence was commuted on medical grounds, a development that Nora did not have to pretend was satisfying because she had not been holding her satisfaction in the shape of his specific punishment. Colbeck's censure remained permanent. His advisory role was not reinstated. His name appeared in the congressional record in terms that anyone researching his history would find immediately. He had declined to speak without counsel in a briefing room, and the record reflected that, and would continue to reflect it regardless of how many years passed. Nora's military record was formally corrected in December of that year. The 2010 complaint was reclassified from unsubstantiated to substantiated, with a notation that the original classification had been improper and had been made by individuals now under criminal and administrative sanction. Her discharge from the rehabilitation unit was reclassified as retaliatory separation. A formal letter from the Secretary of the Army acknowledged this and expressed what it described as the institution's regret. She read the letter at her kitchen table. She folded it and put it in a drawer and made herself a cup of coffee and sat by the window for a while. It was not nothing. It was also not everything. It was the institution producing language for something that language could not fully address, and that was the nature of institutional accountability. It arrived in documents, in records, in reclassified notations, and those things mattered and were real and were not the same as repair. The dogs that had died were still dead. The years of pain that the surviving 43 had endured were still years. Her own 14 years were still hers. But Ranger walked into his 16th week of physical rehabilitation with a gait that Gina had described in her most recent assessment as approaching baseline normal for a dog his age and structure. He would never run the way he had run at peak service. That window had closed, partly because of the fracture and partly because of the year of compensatory damage. But he moved without the careful protective waiting that had defined his movement since before Drake had started noticing something was wrong. He moved the way a dog moved when his body was not constantly negotiating with pain. She saw him on a Tuesday afternoon at Gina's facility, working a structured exercise course with Drake at his side, and she stood at the observation window and watched him complete a controlled turn on his repaired hip and continue forward without breaking stride. And she felt the things she had not been able to name in the therapy pool 9 weeks earlier settle into something she recognized. It was not triumph. It was not vindication exactly, though vindication was part of it. It was the specific satisfaction of having looked away. When looking away would have been easier and continued to look at the thing that required looking at, for as long as it required looking at, until it was resolved, that was all she had ever done. That was, she thought, enough, more than enough. It was everything. If you did it long enough and carefully enough, and without letting the years or the cold sandwiches or the folding tables or the people who called you furniture make you forget that the reason you were doing it was real. The 43 dogs were named in the congressional record. Ranger walked without compensating. The copies in the fireproof pouch were in federal custody, and the pouch itself was in the bottom drawer of her desk, the false bottom gone now, because there was nothing left to hide. And the nurse nobody had bothered to learn the name of was the reason that any of it, all of it, had been possible. That was not a small thing. That had never been a small thing. The ones they overlook are often the ones who see the most clearly, who document the most carefully, who hold the longest, who wait with the specific patience of someone who has decided that the truth is worth whatever the waiting costs. The ones they call furniture, the ones they clear